I will tell you that our best interest is, or what is best for our community. I would tell you also that we are not a legislative body. We are a corporate board, and we work very closely with our administrative staff and our medical staff to serve the healthcare needs of our community. What I would like to do briefly is introduce our board members so that you know who they are, and if they will just wave at the crowd, because I don't think we've had this many. But I'd like to introduce our vice chairman is Brad Baker. Brad represents the Northern District in Sarasota County. Our secretary is Bridget Fiorici. She is from the Central District. Our treasurer is Greg Carter. He is from the Southern District. Britt Reiner, who chairs our quality committee, she represents the county at large. Patricia Mariah is co-chair of quality, and she is from the Southern District. Sarah Lodge over here is chair of our audit committee, and she represents the Central District. Sharon Wetzler Peters is chair of the Human Resources Committee, and she serves at large. Victor Rohe is chairman of our investment committee, and he represents the Northern District. And as our community has expanded, so is our hospital. We have over now 8,000 employees across multiple locations, and they are dedicated to serving the healthcare needs for over 1 million people in this past year in the Suncoast. Some of them are here today in our audience, and we thank them for their service. I also want to thank all of the citizens, and I use that word respectfully, all the citizens who have come out today to share their concerns, their stories, and offer their comments to the board. You are like the citizens in 1924 who came together for the betterment of our community. And I know that just like them, that we all here have the same desire to do what is best for our community and improving of our hospital. So I thank you for your passion. I thank you for your care. Thank you for your concern, and thank you for being here. So let's begin our meeting. I want to call on our distinguished chaplain, Chaplain Preach, to lead us in an invocation, and will be followed with the pledge of allegiance. Would you please stand? Chaplain Preach.
Thank you. Let us pray. Dear Lord of all, we come before you this day to do this business of healthcare under the banner of heaven. Like millions of communities before us, we ask for you to give us the gifts that we need for this hour especially. We request the continuing gifts of compassion, understanding, civility, and wisdom to be especially present at our time together this afternoon. Keep us mindful of not merely part of the truth, but the full scope of the truth. Let us remember with thankfulness in our hearts today, that the time, talent, and emotional investment of our medical professionals is real. And the 8,000 skilled and competent hospital staff who all work hard to care for our community every night and day. Help us to remember that they are gifts to us too. Help us to be mindful of the present and the future needs of the citizens of this county. Help us to continue to give our best. What we really need is that you be with us, to comfort us by your presence, and to heal our hearts and make us full. Give us grace this day, I pray. Come and help us, please. In the name of our Lord.
Amen. The flag is this way. I pledge allegiance to the flag of the United States and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Please be seated. We're going to do some housekeeping before we begin our meeting. I have to read a statement about public comments. I'd also tell you that if you hear mom's lullaby chime during our meeting, for those who've not been here before, that is a sign that a new birth has occurred at the hospital. And it rings twice, back to back. They're twins, and I won't go further than that. But anyway, all right, this is a required statement that has to be read. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. Comments will be heard in the public comments section of the agenda. Speakers are asked to limit their comments to 3 minutes. The chair may find it necessary to limit the time for comments in the interest of time. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or negotiate claims at this meeting. So let me first call the meeting to order. We have the second item, approval of the orders of the day. I would like to ask the board for permission to change the motion for. Oh, I'm sorry, please. Bridget does. All right, Bridget.
In order to keep the public comment and quality committee report contiguous, I move that we amend the orders of the day to hear the president's report immediately following the financial report, and move that we adopt the orders of the day as so amended.
Thank you for that motion. Is there a second? Any discussion? All those in favor say yes. Thank you. Next, business item. You cannot hear me? You can hear her. Her motion was to amend the orders of the day to give maximum time for the public to comment regarding the report of the quality committee, thereby moving the president's report up one item. Pretty simple. So, approval of the minutes of the meeting of January 17th have been distributed. Is there a motion to accept the minutes? Motion by Eddie. Dick, second. Discussion, all those in favor say yes. Any opposed? Motion passed. Next item is board reports. There are no board reports at this time. I'm going to call on the president to present the Excel award, and I will assist him.
Good else?
Yeah.
Okay. Well, sorry, back everybody. I don't know how to do this other than what I'm doing. So we every month we recognize an Excel award winner and think of it as an employee of the month deal. Except it's really a great honor that we have the opportunity to do this every month. It was started many years ago by a friend with the hospital and somebody who continues to work closely with the hospital, Mr. Jim Tollerton. I think, Jim, you're in the audience somewhere, right? There you go. Mr. And how long have you started this? 34 years ago. So we've had an awful lot of Excel award winners since then. So at this point, I am going to invite up our Excel award winner for January, Dustin. Stuff. Come on. I'm not sure why all these people came, but it's all well for all these cameras that are here. Come take a moment to introduce you to a lot of your friends that are here. So it's my privilege to present the January Excel Award winner to Dustin Thomas, a respiratory therapist lead in respiratory services. Dustin has been an employee since 1999 and is known as the Renaissance Man of respiratory care due to his exceptional expertise. His official role is team lead, but that title doesn't fully capture his great knowledge and leadership. In addition to his supervisory role and his excellent work as a registered respiratory therapist, but also maintains his skills as a NICU transport respiratory therapist and serves as the director for hyperbaric. He is a go-to clinician in a situation and goes out of his way to mentor staff. Dustin also has made vital contributions throughout the pandemic in improving workflow and use of equipment and PPE. Dustin, you're truly doing great. It's good to be part of your more. Thank you.
This is an Excel certificate. Justin received a plaque documenting this, but the Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes Justin Thomas with the Excel Award for the month of January. Thank you for your continued service. That's always fun. And pre-COVID, we used to present the Excel Award at the board meeting, and we are starting to re-implement that. The next item would be the medical staff reports, and I'd like to call on Dr. Jim Fiorica, Chief Medical Officer for our healthcare system, to begin with medical staff. Nothing to report. Thank you. We'll also have Dr. Jonathan Hoffberger, Chief of Staff, report.
I would ask for a motion approving Sarasota Memorial Hospital's Sarasota delineation of privileges as amended, gastroenterology, otorhinolaryngology, pathology, and pulmonology as recommended by the Sarasota Medical Executive Committee.
So moved.
Is there any discussion? I just make this one comment for our audience. We haven't had this many visitors. We meet in committees before the board meeting. There's a lot of discussion that goes into these motions. So if you don't hear any discussion here, it's not that we have not given thought to it and quizzed the medical staff. Hearing, is there any discussion? We have a motion and a second. All those in favor say yes. Opposed? Motion carries.
Thank you, Mr. Chairman.
Thank you, Dr. Hoffberger. We also have Dr. Chris Jefferson with us, Chief of Staff at SMH Dennis, with a recommendation.
Thank you, Chairman. I would ask for a motion approving Sarasota Memorial Hospital Dennis delineation of privileges as amended for gastroenterology, otolaryngology, pathology, and pediatric neurology as recommended by the SMH Dennis Medical Executive Committee.
So moved.
Any discussion? Hearing none, we'll call for a vote. All those in favor say yes. Yes. Opposed? Hearing none, motion passed. Anything else? Thank you, Dr. Jones. Next item is the Secretary's report. Bridget Fiorici. Yeah.
Sorry.
For Monday, March 20th, 9 to 10:30 is the Finance Committee, 10:30 to noon, Human Resources Committee, noon to 12:30, closed session, School Board meeting, 12:30 to 2, Financial Review, Board issues, board lunch, and 2 to 4 is the board meeting.
So, any questions for Bruce? Hearing none, we'll have the treasurer's report. Mr. Carter.
Thank you, Mr. Chairman. I move approval of the bad debts of charity care for the month ending January 31st, 2023, in the amount of $21,608,000.
Motion, Mr. Carter.
Yes.
Second, any discussion? All those in favor say yes.
Yes.
Opposed, motion carries. I'd like to call to the front, Mr. Jim Limbacher, our Chief Financial Officer. I'm sorry, Jeff. Financial report.
Thank you. This is the Sarasota County Public Hospital District financial highlights for the month of January 2023. So that will be 4 months through our current fiscal year. This is total revenue for the system in our rating agency format. The numbers on the screen are in millions, but or in thousands, pardon me. So for the month, in the first bar to the left, we had actual revenues of $153,922,000 versus a budget of $132,406,000. Moving to the right, the fiscal year-to-date numbers, we have operating revenues of $562,504,000 actual versus a budget of $487,619,000 through January. Moving on to expenses, again, the rating agency format for the system in its entirety. For the month of January, we had the bar all the way to the left. We had expenses of $141,462,000 versus a budget of $121,678,000. And the bar charts to the right, the fiscal year to date, expenses of $527,005,000 versus a budget of $469,430,000. Our resulting operating income for the month of January, $12,460,000, which is an operating margin, if you see at the bottom, the percentage of 8.1% versus a budget of $10,728,000, also on a percentage basis, an operating margin of 8.1%. To the right, again, our fiscal year-to-date numbers, operating income of $35,499,000, which is an operating margin of 6.3% versus a budget of $18,189,000, or an operating margin of 3.7%. Moving on to some volume statistics. These numbers are year-to-date, so the entire 4 months of the fiscal year. Our average daily occupancy for the hospitals was 877 patients versus a budget of 711 patients. If you look at the boxes below, you'll see the acute length of stay for Sarasota's campus, main campus here is 4.77, and you see Venice's acute care length of stay for the 4 months of 3.91. To the right, our admissions and observation cases, we've had 24,621 at the hospitals, actual versus budget of 20,385. More statistics year-to-date, surgery cases to the left, 10,425,000 for the hospital campuses versus a budget of 9,157 cases. And then births in the bar chart to the right, 1,505 births versus 1,452 for the budget through January. And it's an outpatient data, or outpatient registrations for the hospitals year-to-date, a total actual of 194,186 versus a budget of $187,552. And our emergency care registrations, actual of 59,764 versus a budget of 47,934. And then our last slide is our acuity or case mix index. Bar charts all the way to the right. We have at the Sarasota campus, our case mix index for all patients through the 4 months of the fiscal year to date is 1.82. Our Medicare only case mix index is 1.91. For the Venice campus, our all case mix index is 1.58. And our Medicare case mix index in Venice is 1.65. Mr. Chair, that concludes my report.
Thank you. Any questions for Jeff? I just mentioned for the audience, our financial statements are on the website in much greater detail if you're interested in pursuing the financial statements each month. Our next item on the agenda is the President's report. David Barron.
Thanks, Mr. Chairman. I'm going to start my report like I do each month with our organizational report card. Just to let everybody know how this works, we look at our fiscal year to date, which our fiscal year starts in October, and we look at 5 different organizational areas. The first being service, and we have our goal of our service be a likelihood of recommending in the 75th percentile or greater in those services, and we have a goal of 8 out of 10. Happy to report that we are hitting at 9 out of 10. I'll show you the detail on that in a minute. Second area of focus is on people. We have our new hire retention percentage, which is our full and part-time employees that are hired within the fiscal year that are still employed as of the end of the year. We have a goal of having 83% of our employees be maintained. Happy to report we are tracking higher than that as well at 92.81%. And the third area of concentration is quality. Our goal is to have our combined overall standardized infection rate be 0.8 or less. To remind everyone, the expected number on that for the national average is 1.0, so we already set our goal fairly aggressive to that. I'm happy to report we're exceeding that at 0.69. Next down is finance, which is, we have our, and you just heard from our Chief Financial Officer, Jeff Limbacher, go through that. So we have our operating margin, which is our budget, being at 5%. Happy to report we're trending a little higher now, right now at 5.9%. And then finally, the growth goal has 2. One is inpatient admissions and observation outpatients, being at 61,950 for the year. We are projecting to exceed that as well at 74,822. And in outpatient registrations, the goal is 1.3 million, and we are projecting to exceed that as well, 1.37 million. So looking at our patient experience report card in more detail, and we'll just walk you through the graph. The left-hand side is likelihood of recommending, and it gives you the 10 areas that we survey on an everyday basis. Then the middle column is the score we have for year to date. The next column over is the national median score, and then finally the farthest right is the 75th percentile. As I said, I'm happy to report that we're hitting 9 out of 10 of these in the 75th percentile. The one that's one off is our radiation oncology area, which is only 1 point off, but certainly hitting the national median score. So a lot of good work that goes on in that every day. I had the opportunity to present our plans for growth in South Sarasota County earlier this month. So we had the opportunity to present at the Transforming the Community for Tomorrow Forum that was held in Northport. The Economic Development Corporation of Sarasota County hosted this event. So I want to reach out and thank the people in Northport that came out and listened to us and asked some great questions about our plans. we have already started having physician lectures, starting back on our campus. Here is, I know you can't read this without an eye chart, but it is, gives you a lot of the different lectures that are coming up, and we do put all this on our website, and I would encourage you to go in and take a look at that and sign up with your second comment. Earlier today, we honored our Excel Award winners, our award winner for the month, and earlier this year, what happens is every one of our Excel Award winners and our Leader of the Quarter winners all become eligible to be the Employee of the Year and the Leader of the Year. And we had the opportunity to recognize both of them this past month. So Sarasota Memorial recently announced our Employee of the Year and Leader of the Year. These special staff members have chosen annually from the previous year's Excel winners. Congratulations to our new Employee of the Year, Audrita Reddick, Physician Lounge Attendant and Food Nutrition Services. Audrita is well known for her outstanding customer service and is described as a ray of sunshine by our medical staff. Also, kudos to our Leader of the Year, Jamie Kiskin, Pharmacy Manager of Education and Research. Colleagues say Jamie provides an outstanding leadership in all areas, played a vital role throughout the pandemic, and is a gifted human communicator. Congratulations to both of them. We had our latest SMH Healthcast episode discussing Parkinson's disease on our podcast. So in our most recent Healthcast, Wanda Jackson, our outpatient care coordinator at SMH, shared some of the many resources available in the Sarasota community for Parkinson's patients and their caregivers. And I would just invite anybody in the public to go to our website and go to our podcast. We keep all of them there, and they're fascinating and interesting, and a lot of them good information on this. So I would encourage you to go there. We also have Self-Care Saturday, focuses on women's wellness this Saturday, February 18th from 10 to 2. Please go to our website. You see on the calendar section of our website. You can get all the information there. But once again, a lot of great speakers come out and talk at that. A lot of world-renowned physicians that we are so lucky to have in this area. And I would encourage you to do that. We have been experiencing significant volumes, record volumes in our organization and in all three of our emergency rooms, both this campus, the Venice campus, and the third emergency room on Toledo Blade. We've put out a lot of communication about how to make a decision on how to choose to go to an emergency room or go to an urgent care, of which we have 6 urgent cares around as well. So you can see a link there on our website for that, but it's important to know the differences. It'll certainly help you as a patient gets the right level of care, but also make sure the system can stay as open as possible for the right level of care. And then finally, we had last week, we had a guest come and talk about his experience in our trauma center, Congressman Greg Stubbe. And I know we had filmed some of his comments the other day, and maybe one doesn't today. So, Karen.
So I just want to thank you all for being here today, because SMH doesn't get the recognition that you sometimes see. David talked about the 4,800 patients a year that are treated here, and I went to law school, so my math's not that good, but that's 13 patients a day. And so think about the impact that that's having in the community. And but for people like Nick's family, and but for me being here, the attention happens because of something like that. But every day, on average, there's 13 patients that go in and out of the ER and the trauma center. And the unsung heroes, all of you, Dr. Ollie's team and all of you who spend so much time taking care of all these residents and the people here. And I thought it was appropriate and important that we have the TV cameras here and the folks here today to bring attention to this treasure in our community. Because it goes unsung for so long, and every day you guys come to work and save people's lives, and it's not mentioned in the paper, it's not mentioned. You do your job every single day in saving people's lives, and you go home with the heart that is knowledgeable of the things that you've done to help people and save people. but the community sometimes looks over the fact that we have this gym right here in this community. I would submit that the majority of people in Sarasota don't even realize that we have a level 2 trauma center here until they either fall off a ladder, or they're in a car accident, or they're in a boating accident, or something significant happens to themselves or a family member, and they show up here and then suddenly are appreciative of the investment that SMH has made in the trauma centers in this region. So you don't realize the benefit to the community until something happens that you see that it's there, which is, I think, my main purpose in having this event today was so that every citizen of Sarasota County can see how lucky that they are that they live in the community, where if something, God forbid, does happen, you have very strongly skilled staff and doctors here that can provide for their medical needs.
So just to wrap up, I want to thank Congressman Stubbe once again for coming and thanking our staff and saying those very kind words. Mr. Chairman, that's my report. Happy to answer any questions. Yeah.
Any questions for David? Move on to our next. We'll move to our next item, Brett Reiner, committee report from the fall.
Thank you, Mr. Chairman. Okay.
Everyone here in the back.
On November 29th, 2022, we, the Sarasota County Public Hospital Board, had 4 new board members take office, voted in new officers of the board, and after hearing public comment, voted unanimously to conduct a review through the hospital board's quality committee of the care Sarasota Memorial Healthcare System provided throughout the COVID-19 pandemic. All 9 board members serve on the quality committee. In December 2022, the new hospital board chair, Tram Hudson, appointed me, Brett Reiner, as the chair of the quality committee, and new board member, Patricia Mariah, as the vice chair of the quality committee. We worked separately, as I will remind the public that Sunshine Law precludes us being elected officials from serving on a board, that we serve on a board together to discuss topics that may come to a vote unless it is done so at a previously scheduled meeting at which minutes are taken. So we work separately due to Sunshine Law, yet also in collaboration with the chief of the medical staff, Dr. Jonathan Hoffberger, and the chief medical officer, Dr. Fiorican, and assembling a COVID-19 panel to review the policies, procedures, and practices instituted as part of its pandemic response. The COVID-19 panel was made up of over 70 hospital and physician leaders, members of the existing COVID treatment task force, peer review specialists, pharmacists, clinical researchers, case managers, clinical educators, laboratory scientists, nursing, logistics, and other department managers. We worked separately, yet in collaboration, to draft an outline of the report, which I then presented to all 9 board members of the quality committee in January to get further input from them. No one had substantive additions to the outline. We then discussed how the report, if it were to be accepted by a majority of the board, would be presented at the public board meeting, which is today, February 21st. The board unanimously decided that I would give a brief outline of the report and we would make a PDF available to the public after the meeting. The panel reviewed the policies Sarasota Memorial employed to safeguard staff, patients, and visitors throughout the pandemic. It included guidelines and references clinicians used in decision-making and treatment of COVID patients, and included strategies to manage staffing challenges and critical shortages of space equipment, supplies, and medications, and comparative measures that benchmark organizational performance and clinical outcomes. Patricia, Mariah, and I met several times with clinical leaders to discuss details of what would become the report. This panel, the hospital board, and Sarasota Memorial leaders thank the many physicians, staff members, patients, and families who shared their experiences for contributing to our understanding and for enabling this report. The comprehensive report includes a comparative analysis of COVID clinical outcomes. We did not crunch our own numbers. Instead, the panel benchmarked the performance of the health system utilizing data provided by Premier Inc., an independent quality improvement organization used by state and federal agencies in more than 1,300 hospitals across the nation. Sarasota Memorial has been benchmarking itself against Premier data for the last decade, and it is the largest in the country of its kind. In addition to the statistical data, the report also evaluates COVID precautions, testing and care teams, COVID treatments, communications with families and visitation policies, capacity challenges, transparency and public education, COVID vaccination policies, staffing challenges, financial impacts, and the simultaneous work undertaken to meet the healthcare needs of the growing Sarasota community. The board received the preliminary report for discussion this past Thursday, February 16th. All board members had scheduled meetings with Drs. Hoffberger and Fiorica yesterday on Monday, February 20, to ensure they had the opportunity to have initial discussions, again, given sunshine law preclusions. Today, from 8 a.m. to 12 p.m., the Quality Committee, which again consists of all 9 elected board members, met in closed session in accordance with Florida statutes, which exist to achieve the goals of quality improvement and peer review. Dr. Fiorica walked us through the report and board members shared their responses. The committee recommended to the board to accept the report in an 8-1 vote. We will soon vote officially as a board. Additionally, the board tasked the Committee on Professional Enhancement, known as CPE, which is the highest quality committee of the medical staff, to review the records of 9 COVID-19 patients at Sarasota Memorial Hospital and present their findings on the care of 5 specific patients, which were designated by our board chairman. 5 different physicians led the quality committee through each of the cases. Physicians found that all cases met the standard of care. Some may question whether families were interviewed in this process. While physicians reviewing the care were aware of the concerns of the families, and the findings of the committee are in the process of being communicated to each of the families, the physicians focus on the contemporaneously created medical records and other records of the patient's care to come to their determination. It was a review of the medical records. This is consistent with and a part of the recognized and time-honored peer review practice and the foundation on which all relationships between medical staff and hospitals exist. Returning to the COVID-19 pandemic response report, while a full report will be made available to the public after this meeting, should the board vote to approve the committee's recommendation to accept the report, I will mention some of the key findings regarding mortality. In every iteration of the virus, SMH's mortality rates were better than the state, southeast, and national expectation for our patient population and comorbidities. For the state, 22%, and for the nation, we were 24% better. It's important to note that we took the sickest of the sick from other hospitals and we turned no one down. I'm thankful to say that 91% of our COVID inpatients did survive the virus thanks to the care that they received here. It is also important to note that many have commented on the use of ventilators. Only 11% required ventilator support throughout their inpatient status as a COVID patient. Regarding the length of stay and readmission rates, the number of COVID patients readmitted within 30 days of discharge from Sarasota Memorial remained consistent with expected levels during the years 2020 and 2022. However, in 2021, readmission rates at Sarasota Memorial were higher than some of Premier's comparison groups, reflecting the additional strain placed on large medical centers during the surge of the Delta variant. There were times at which the hospital was at capacity, so we intentionally, safely discharged patients with home monitoring systems, way more than an Apple Watch, in order to allow room for the sickest of the sick to receive care without compromising anyone's care. These wearable sensors enable disease management nurses and hospitalists to monitor the vital signs throughout the day. Also compounding capacity constraints were the requirements needed to discharge many of these patients returning to assisted living facilities. Approximately 50% of our patients were returning to such facilities and required 2 negative COVID tests, often multiple days apart, again, limiting our ability to see more patients in beds and care for them. However, our hospital was very innovative. Our ICU normally only operates at 62 beds, but they were able to expand their ICU, doubling it, at a time at its height with Delta, caring for 82 COVID patients in ICU with a full ICU of 116 patients. In fact, if you've ever received a surgery here, you may have been in the pre or post-op space, and that was actually converted to be an ICU for all non-COVID patients. Again, should this report be approved, you will see a stunning photo in the report of what our hospital leaders were able to come up with, so we were able to provide the most care to the most people. Regarding financial impact, over the last 3 years, Sarasota Memorial sustained a $38 million loss in revenue and more than $77 million in increased costs directly related to the pandemic. This includes the canceling of elective surgeries, sometimes at the governor's order, sometimes because we simply did not have the capacity. This was also due to the need to hire contracted labor or pay premium pay to ensure that we had healthcare professionals to care for the patients we had. Again, during the Delta phase, we saw a 100% increase in expenditures on contracted and premium labor. While the federal government's provider relief funds, which were a part of the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act, helped offset the financial impact, Sarasota Memorial's net loss over the past 3 years amounts to nearly $66 million. This does not include the significant inflation the health system is currently experiencing in labor and supply costs. The report examines more findings and statistics worthy of consideration. Again, should the report be made public with board approval. But now I want to highlight some of the key recommendations it cited for the healthcare system moving forward. While the precise circumstances of the COVID-19 pandemic may never arise again, there are important takeaways from the last 3 years that present opportunities for improvement. The report called for 1, the formation of a health emergency response committee to help Sarasota Memorial effectively and efficiently respond to future operational challenges and public health events. This will be activated as novel health challenges are identified. It will be comprised of medical staff leaders and physicians from all impacted areas, senior administrative leaders, and representatives from impacted areas, including nursing, pharmacy, the emergency care center, supply chain, food and nutrition, environmental services, and others. It will include representatives from the patient advocacy department. It will include representatives to advocate for staff and prevent a clear pathway for consideration of employee concerns. It will include dedicated communication staff to ensure messaging is consistent, timely, and accurate. It will serve as a clearinghouse for evaluating novel treatments or preventative measures. It will make recommendations regarding the implementation of measures to ensure communication between and among families, among patients, families, and the clinical team, including the use of patient advocates. And it will provide regular reports on their activities to the board. Number 2 recommendation is the continued development of home health and post-hospital services and resources including remote monitoring capacity to reduce the length of hospital stays and strengthen the community and healthcare system's resilience going forward. As capacity issues continue to challenge the community and health system in the future, and even today, we've been operating in the last several weeks at 100% capacity, and sometimes over that at our Venice hospital. The ability to provide patients with step-down care after they leave the hospital is critical. Particularly during surges, patients who are relatively less sick may be able to recover safely at home and in non-hospital settings with sufficient monitoring and support to face health challenges that develop after discharge. We recommend that Sarasota Memorial continue to develop and expand resources to support discharged patients, including evaluation of hospital at home and other programs to allow eligible patients to be safely cared for outside of the hospital, with continued investment and growth in remote monitoring capacity and capability, and the continued investment and development of subacute home health services to keep patients on a wellness trajectory and quickly identify when patients are facing health challenges, especially those that could result in readmission to the hospital. The third recommendation is the deployment of more dedicated staff and the increased utilization of technology, such as iPads, to improve communications with family members and between patients and their loved ones. While the pandemic exacerbated the communication challenges in ensuring that patients, their families, and caregivers face, the challenges are not unique to a health emergency. The report recommends the use of virtual meeting technology, including the use of easy available tablets and devices, to provide patients and families with a convenient, reliable way to communicate when they cannot physically be together. And lastly, number 4, to build on established strengths in communications and information sharing by enhancing awareness of communication pathways for employees, medical staff, and the public. The pandemic posed challenges to the normal flow of information to and within Sarasota Memorial at a time when many people wanted to communicate with the organization. While Sarasota Memorial has a variety of established formal and informal communication pathways, not everyone was aware of all the communication channels available to them. As Sarasota Memorial and the community it serves continues to grow, it is important to raise awareness of the different ways that patients, family members, physicians, staff, and other community members can make their voices heard. We recommend that Sarasota Memorial develop an outreach and education plan to highlight the ways that stakeholders, again, staff, family, community members, can communicate anonymously or by name with medical staff leadership, senior administration, and the board. Lastly, in presenting this information, I want to cover 2 things. 1, all of this work was accomplished while we were opening up the Venice Hospital, which was a very good thing because none of us expected that the Shore Point Hospital would close and we had to absorb their patient census. It also occurred while we weathered and suffered Hurricane Ian. We were the southernmost hospital that did not close its doors and actually set up a disaster medical assistance team. One of the best that the DMAT has seen, and is actually now being used as an example across the country, where more than 80 healthcare professionals worked with ours to care for people who had been affected by the storm. And finally, we were able to open up an 8-story oncology tower and expand with our radiation oncology center, all while also beginning to build the behavioral health pavilion to help care for the mental health care needs of our community. I dare say there is not another healthcare system in the country that has embarked on such a daring expansion of services to meet its community needs during the last 3 years as ours. Finally, I want to say how proud I am of this report. The willingness to engage in self-critical analysis is a strength of any person or institution, and it is certainly the strength of Sarasota Memorial's. In our research of other healthcare institutions, we found none that did such a comprehensive review of the last 3 years, nor found ways to do substantively better. It is one thing to have an independent third-party data source inform that SMH's COVID mortality rates were 22 and 24% better than the state and nation respectively. Figures that, if applied, could have meant 38,000 deaths could have been avoided. It is one thing to find that. It is another thing for our doctors, nurses, and staff to submit themselves to a grueling review process that none of their peers in the nation did or are doing, all while continuing to care for thousands of patients. To me, this says that local citizens can have confidence in our community's largest employer and #1 destination to receive healthcare. As Congressman Stubbe said last week at his press conference held here at Sarasota Memorial, in which he celebrated the life-saving efforts of our trauma team, Sarasota Memorial is a treasure, a gem, and the residents are lucky to have it.
Thank you, Brett, for that outstanding report. Just so the audience knows, we spent 5 hours this morning going through over 200 pages of a report that was rendered by our medical staff at the direction of both Brett and Tricia and their work, and the other board members who had input into it. That was a great summary of the report. Thank you for making that report. We could have board comments now, or what I would suggest is that we hear the public at this time. We have over 55 folks who have signed up to speak, and I've been given these sheets in order. I would ask that the speakers limit their comments to 3 minutes. I would ask that the audience refrain from clapping, whistling, heckling, gesturing, loud conversations, and disruptive behavior when speakers are speaking. I would also ask that speakers refrain from personal attacks, abusive language, or redundancy. I figure that 55 speakers at 3 minutes each, that's approximately 3 hours of testimony that we'll receive. So with that, I think we'll begin, and I will call out 3 names at a time. And if you could approach the podium, we'll welcome your comments. We will stay here till the very end, till everyone has a chance to put their opinion. And as Britt said, that upon a vote later, we will release the full text of the report and the accompanying slides. So, being first on the list is Melissa Embry, to be followed by Dr. Rick Yardura, followed by Natasha Mink. Ms. Embry, are you in the audience?
Right.
There you go.
Great. My name is Melissa Embry. I'm a lifetime resident of Sarasota. Thank you, board members, for allowing me to speak today. When you fill out emergency contact forms for your children, you're asked to have special preference for your hospital. I have 4 children. We have a lot of sports, we have a lot of activities, but I've never been down anything other than Sarasota Memorial Hospital. So why does that matter? Well, many of us are here today because a question of trust has come into play with regard to our hospital. I was born here, in this building. My husband was born here. We chose SMH for the births of our 4 children because we knew that it would be the best option if anything were to ever go wrong and we needed the best doctors and nurses available to us, and either myself or one of our children did not have a healthy outcome. We chose this hospital because we trust the staff, the nurses, the doctors, and the governing board. Less than 2 weeks ago, I was in the emergency room with my 12-year-old son who had pneumonia. And while he was terrified of this very new experience for him, I wasn't at all worried that he would not be receiving the best care possible from this hospital. From the time that we arrived to getting discharged, the entire team, be it the registration desk, the x-rays, everybody was attentive, kind, thorough, and trustworthy. The emergency room, these hallways, elevators, and patient rooms all served as a second home to me growing up. My mother was deemed permanently disabled at the age of 31 and has undergone almost 40 spinal cord surgeries in the last 40 years of my lifetime, many of them right here. I trusted SMH to care for my mother when I was only a child. Since 2008, I've been my mother's healthcare surrogate, and in the last 5 years, she has been admitted to this hospital 1 to 2 times a year in timeframes ranging from 1 week to 2 months. Oftentimes, she's endured lengthy stays in the ICU, most recently in July of 2020 and well into the COVID-19 pandemic.
1 minute.
My mom was fighting for her life with internal bleeding and sepsis. I wasn't able to see her, but the nurses gave me constant communication, and I was never worried because I trusted them. I continue to choose SMH and healthcare professionals here because I trust them to take care of the ones I love the most. Finally, I have a friend whose parents were admitted in May of 2021, both with COVID-19. She's not able to be here today. But she wanted you to know that after nearly 49 years of marriage, her friend's father passed away from COVID-19 in this hospital. Her mother was moved to ICU and eventually got to go home to her 2 daughters. And friend has nothing but thanks and gratitude to this hospital, given that she lost one parent to COVID and the other one got to come home. She's thankful to all of you and all the nurses, the doctors, and staff. This is trust.
Dr. Rick Madura, followed by Natasha Finke, followed by Dr. Washington Hill.
So I'm a cardiologist in Sarasota since 1997, and I've been asked to come up and speak to you folks regarding what I experienced as a cardiologist dealing with life and death on a daily basis. And being accustomed to seeing mortality, it was the worst experience of my life during this pandemic. A lot of people that saw it, it was incredible. I also want to say that we reached out to our friends in Europe, South America, and amongst our own departments and fellow colleagues discussing options for treatment before we knew how to treat the process, what was going on. COVID will affect cardiovascular patients with heart disease, heart failure, and so forth. And so we're dealing with a lot of emergent cases, patients having heart attacks, and still not knowing what was the best way to do it. But with communication, through research, and process through our hospital that they instituted, we've done great. What happened to me is I went through that season of 2021 where we had tremendous amount of mortality. Everybody's starting to get a little bit more relaxed about what was happening. We had a lot of collateral damage. A lot of our elective procedures were canceled. Those patients came in truly ill. And we had some of our patients wait for the elective surgeries to die because of what was happening with the pandemic. But the latter part of April, I personally started to feel not too well. Protected, vaccinated, for 3 weeks tested negative. And finally, my wife and my son forced me to come to the hospital after I had an infectious disease doctor. One of my colleagues come to my house to look at me and asked for me to be admitted to the hospital. I got admitted, my saturations when I was admitted was 84%. When I was ambulating, I couldn't breathe. And apparently I was getting a little bit disoriented. My family, my kids, we had just come back from a trip. They flew in from Boston and from California. And I had a discussion with my wife that day because I had left it not to want to be intubated if I needed it because I saw the outcomes of what would happen and I knew it's not a good sign if you have to have that. But I also knew that there was therapy treatment. And they instituted therapy on me with remdesivir. And within 12 hours, I got a call from the chief medical staff, Dr. Hoffer, and asking how I was feeling. I was 1,000% better. So the care that I got, the treatment that I saw work while we were going through the pandemic was incredible. I left the hospital in 5 days, and I was back at work in 2 weeks. That was my experience. My last 30 seconds. As I saw that this was developing about the investigation looking into the care of this, the people, the physicians that I work with, critical care, pulmonary medicine, the surgeons, our heart surgeons that we have to deal with, infectious disease, extraordinary. It's incredible. I think this should have been applauded every day of the pandemic, and maybe not.
Okay, I don't want to sound like a high school teacher, but please, if you refrain from clapping, we'll probably be able to get through this in 3 months. So I know that you want to cheer people on, but please, if you'll hold your applause, really appreciate it. Next is Natasha Mickey, followed by Dr. Washington Hill, followed by Tanya Harris.
Hello, thank you for having me today. My name is Natasha.
You're speaking to the microphone.
Can you hear me?
Yeah.
Okay. I have a unique position in that I have unfortunately had a lot of experiences at Sarasota Memorial, however, extremely positive. I have lost my husband 9 years ago, and the staff, literally from the janitors to the housekeeping to the nurses, especially, and of course, obviously the doctors, always giving top-notch care and working with Duke and never making us feel like they were, making a choice with that. And then my mom passed away a few months ago. Again, there's a memorial took amazing care of her and never put me on the spot to make hard choice decisions. I also have a little breakfast restaurant around the corner. So I also am speaking with people constantly that are patients here or loved ones here that have just nothing but good things to say. And when I think of Sarasota Memorial, it's amazing how they take care of our whole family, not just us. I also had 5 children here, myself actually also. They were 3rd generation born here. And everybody has done such a great job. I have been fortunate, I will say, to not get COVID, I'm not stated, but I have seen a lot of people and am very blessed that all of you from the ground up have taken great care of my family.
1 minute.
And, I just want to thank you all for being there for us and for the community as a whole, and for having a business in the community with your construction and things going on, that you always reach out and ask me, the parking and just some things people don't really think about that do impact my employees and stuff like that. And you guys are always willing to go the extra mile, and I appreciate it.
Thank you, Ms. Mickey. The owner of the servants, Dr. Washington Hill, followed by Tanya Harris, followed by Ellen McGill. Dr. Hill.
I am Washington Hill. I deliver babies. Very fast long. And in past chief of staff, I've birthed babies here. I've birthed babies for 55 years. Of them here. And no, I don't know how many. I am the founding director of our high-risk pregnancy program, also a member of the Gulf Coast Medical Society, a local medical society of Black and brown physicians and other healthcare providers who were intimately involved in building community trust and saving lives by listening to the hospital and public health officials' words of wisdom and guidance through a shots and arms program. Care was based on evidence, not hearsay, not because someone said so, but scientific evidence. I have 3 minutes, but in that time, I must say, care provided not only in labor and delivery, for moms, mothers, babies, and visitors, but throughout SMH during the pandemic was second to none. We learned as things progressed, instituted best practices, some from other institutions, and some we've then shared with other institutions around the world. Please hear me clearly. The nurses, physicians, and employees risk their lives, and those of their families to care for the community and still do. Some of you are alive today because of the care and outreach of FMH and the Gulf Coast Medical Society. Our work is not without pushback, but we also push back, making this community safe and healthy. Got up Saturday morning saying, where am I supposed to be today to talk about COVID and to make our community safe? If this hospital is to continue
1 minute.
as a first-class center of excellence, seeing all the community, we must stop the bickering and politics and listen to those who know. If you were building a house and would listen to the contractor, you might say, I don't like the fireplace there. But when he said, if you put it there, man, it will probably burn down the whole house, you'll probably back off and listen. And that is true here. Finally, we want your input. In OB, we've heard it over the years, improving services for you. Is all we do here perfect? Of course not. But every day, each 7 o'clock meeting like this morning, we ask, what can we do better? How can we save lives? Regardless of the noise from some here, we will continue to do that 24/7 as during COVID. And we'll be here to take care of you, pregnant or not, you need us, even though you make us defend our good care.
Thank you.
Very much.
Tanya Harris, followed by Helen McGill, followed by Robert, I'm gonna mess this up, I think, Husmon, I apologize if I mispronounced him. Tanya, welcome.
Hello, thank you, board, for listening to me.
Yeah.
I'd like to answer a question that you're all probably wondering. What is it gonna take for the public to stop coming here and asking us all of these crazy questions every month? It's 5 things: transparency, honesty, trust, accountability, and closure. It's not about us being anti-vax. It's not about us being COVID critics. It's not about us having nothing to do all day but pick a public fight. What it's about is the people, the safety and welfare of our community. We are awake, we are aware, and although you can present us with these pretty slides, I appreciate those, it's gonna take more than a slide for us to believe anything, because there's no trust. You, as the public board sitting here today, represent us. Some of you shouldn't be here on this board. If you can't be considerate and hold compassion for lives that were lost and seek closure, then you shouldn't be here. Don't tell us it's about fiduciary responsibility, and please don't tell us how amazing this hospital is. We know firsthand what happened upstairs in those hallways. We know how badly hearts were aching. You cannot fix what you destroyed and what was broken, but you do have the power to engage with us and listen. In some cases, for some family, their closure may just be that they want to sit down and discuss the awful care. Other cases, they just want answers as to why they asked for medications and were denied. And when they review their records, there's no mention of these pleadings in them. I've looked. Every one of us needs our version of closure. Did you ever think about that? When no one on this board responds to our emails, when our speaking time gets cut down from 5 to 3, such as an important time for your constituents, when the chief of staff, who according to his Facebook page thinks we're all nuts, calls his staff here to this room, when our questions were never, the ones that were raised a few months ago have not been answered, when the families were not involved in this review of their own loved one's care, what are we to assume? Please save us the trouble of saying you included family members. I know for a fact 2 of them were just called yesterday. But the question really lies with you. Why are you all here? Because it certainly doesn't look like it's to represent us. I understand Dr. Hoffberger, the chief of staff, asked his staff hospitalists to come here and pack this room for support. And he certainly made sure to say how he felt about us in his memo. So now I speak to those in the audience who showed up to do that for him. Would you please stand up if you feel these families who lost their fathers, daughters, mothers, and siblings don't deserve to have their questions answered, and you don't think they're owed anything? Go ahead and stand up, please.
Thank you, Connie. 3 minutes. Helen Durham, followed by Robert Nussbaum, followed by Sarah Timmons. Dr. Sarah Timmons.
To those in blue and white. My name is Helen McGill, but I'm going to read a letter from my husband, Paul Peterson. To whom it may concern, in late 2019, I went to see Jeffrey Sells for shortness of breath, which turned out to be a defective valve in my heart, requiring immediate open heart surgery. It was quickly determined that this would be best performed by Dr. Jonathan Hochberger, who specializes in this type of operation. The operation took place in January 2020 during COVID with an excellent result. I am healthy and energetic, whereas before I was tired and weak, looking at no more than 2 years of remaining life. I am deeply grateful to Dr. Hochberger and the entire Heart Institute staff at Sarasota Memorial. They saved my life. Sarasota Memorial Hospital is a local treasure. We are in good hands with the doctors and staff there. They have proved again and again that they know how to take care of us, and they do. Let them do their work. Leave them alone. What would we do if they left us? Many communities would be happy to have them. Thank you very much.
Robert Nussbaum, followed by Sarah Temple, followed by Judith Schwartz.
Thank you. I'm Bob Nussbaum. I'm accompanied by my wife, Suzanne. We live in the Sarasota County part of Oklahoma. Despite the fact that Sue and I are a politically based marriage, one Republican and one Democrat, we stand here united in our support for the SMH administration, their science-based leadership, and the outstanding results that they've achieved over the years. Science is the difference between how we live today and how our ancestors lived a mere 10,000 years ago, hunting, gathering, running from large predators, and dying of diseases like smallpox, polio, and tuberculosis, all of which are nearly eliminated today thanks to vaccines developed by science. Science differs from other forms of thought, such as political ideology. In science, for an idea to become accepted as true, it must fit the facts observed, quantified, and documented by multiple independent researchers. Scientific hypotheses and theories must be discarded if they fail this key test of being reproducible by multiple independent observers. It is because of this staff's scrupulous dedication to medical science that this hospital has been one of the most highly rated hospitals in the country for years. These ratings are themselves supported by facts, such as the COVID death rate well below the national average, as we've seen in these presentations today. The facts and the numbers show that Sarasota Memorial Hospital isn't broke. And as the saying goes, if it ain't broke, don't fix it. And certainly don't break it. One last comment. The phrase medical freedom is getting a lot of airtime these days. But like the other freedoms we all cherish, it is not absolute. We have free speech, but we can't yell fire in a crowded theater. We have the right to bear arms, but not to spray bullets into a crowd. Nor do we have the right to spray deadly virus particles into a crowd. Similarly, our medical freedom ends where our personal choices endanger the health and the lives of our fellow citizens. That is the very essence of the concept of public health. Thank you.
Thank you, Dr. Sarah Temple, followed by Judith Schwartz, followed by Pam Biden.
My name is Sarah Temple, and I'm an emergency physician at Sarasota Memorial, and I'm the chief of staff elect for the hospital. I want to take a moment to speak about the pain and the loss that everyone in this room has suffered during the past few years. It's different for each of us,
And it's more profound and more devastating for some than for others. For each of you that lost someone dear to you to COVID, please know I'm deeply sorry for your loss. I won't say I understand, because nobody can really understand someone else's experience of grief. But I want to assure you that while it is a small echo of what you feel, know that every one of us that cared for your loved one grieved for them and for you and your family. Every patient that we lose wounds us and changes us. Most of us have seen more death in the past few years than our previous many years of practice put together, and none of us have emerged unscathed. This pandemic has taken a toll on everyone. I can't imagine what it must have felt like to lose a husband, a parent, God forbid a child. But I can tell you what it's been like to lose small pieces of myself and watch my colleagues and friends suffer similarly. And this is borne out in the numbers. Previously unseen levels of burnout in doctors and nurses, medical professionals leaving their careers in droves, increasingly high rates of physician suicide. Luckily for our community and for the world in general, many of us have been able to push through and continue to do the jobs that we trained for and to which we have dedicated our lives. But I'm not sure how much more that we can all take, especially confronted with insinuations or outright accusations about our motivation and our intent regarding patient care. We have suffered too, and jobs that have always been difficult have become at times impossible. We have been tasked with caring the sickest of patients in the setting of scarce resources, risking ourselves and our families with uncertainty and community backlash. I'm fiercely proud of this hospital and the quality of care that we deliver to this community throughout the pandemic. While we have found areas that we could have handled differently based on what we now know, such as communication with and between families and our visitor policies, the data that we have reviewed shows that care delivered at this hospital was and continues to be at a world-class level. I realize that nothing I can say here will lessen the pain and grief of all those who have suffered. All I can do is express that we, the physicians, nurses, and staff that serve this community, share in this heartbreak. We continue to feel it deep in our souls. You have mentioned a loss of faith in our hospital, and it pains me to hear that. I'm not sure if the data will change your mind or not. I hope it will. But my final words will simply be, if you change your mind, we will be here, waiting to care for you and your family, because that is simply what we do here. Thank you.
Thank you, Mayor. Judith Schwartz, followed by Pam Beidlich, followed by Alan Green.
Hi, my name is Judith Schwartz.
Can you speak into the microphone, please? Thank you.
My name is Judith Schwartz, and I'm a retired registered nurse. During my career, I worked in several states, and always at five-star facilities. So I was a little concerned when I came here about what the care would be in Florida. I got here and I was reassured once I began working in the Sarasota Memorial Healthcare System. 2 years later, I became the director of nursing at a skilled and assisted living facility. When our residents and sometimes staff members were hospitalized, I visited them wherever there were patients. I was always most pleased with the care that I saw at Sarasota Memorial Hospital. When a resident under my care needed emergency hospitalization, I would address the emergency medical squad, bring them to Sarasota Memorial whenever possible. It got to the point where the squads would walk in, take a look at me and say, yeah, we know, Sarasota Memorial Hospital. After a while, I think I began to take the hospital for granted. I expected excellent care, they delivered excellent care, and I didn't really think that much about it anymore. After I retired, my husband and I enjoyed our daily lives. And then my husband needed outpatient surgery. Suddenly my role changed. I was no longer a medical professional. I became family. It's really a big difference. Of course, my husband and I were nervous and really worried. We arrived to the hospital at 5:30 a.m. and there was a valet to greet us warmly, really friendly, steer us in the right direction, and tell us we would have a great day and everything would be fine. Although the hospital was obviously very, very busy, the waiting room was so crowded.
1 minute.
And yet, we were never rushed, felt airy, Everyone smiled, everyone treated us with compassion. Staff and volunteers were patient and caring. Time was taken to answer all of our questions, and we were very pleased with the outcome. I decided to come and share our experiences with you. Since then, my husband needed a bone scan. We were again impressed by the professionalism and the kindness that we encountered. As he continues to need care, we are also very happy that we can continue to turn to Sarasota Memorial Hospital. We're very grateful to Sarasota Memorial Hospital. We feel it's a big asset to our community, and we're happy to be here.
Thank you, Ms. Schwartz. Next, Pam Beisler, followed by Eileen Green, followed by John Coble.
Good afternoon. My name is Pam Whiteley, Executive Director of Women and Children's. During the dose surge, we quickly began to see acutely ill pregnant patients come in one after another. Every day they seemed sicker than the day before. One typical day in the OBECC, a pregnant patient walked in holding her belly and gasping for air. Our staff knew exactly what to do, as this was becoming a very common occurrence. The look on her face had become all too familiar, a look of fear. Fear that she was not going to be okay, coupled with the fear for her unborn child. A plan of care was made within seconds as both the mom and baby were in danger. In collaboration with our OB hospitalist, the anesthesia, the ICU team, respiratory, and our NICU, this mom was in an OR in less than 15 minutes for an emergency C-section. That's what we do so well in this hospital. We collaborate and work as a team for the best outcomes for our patients. The baby was born 8 weeks early, weighed only 2 pounds, and spent many weeks in our NICU. Mom stayed with us in labor and delivery, where we spent days at her bedside until we could wean her oxygen requirements down and she could recover from COVID. That new father came very close to losing both his wife and her baby. Because of the care received in this hospital, I'm happy to tell you that both mom and baby fully recovered. This is just one story of so many like it. This scenario played out over and over. And if you had a record-breaking volume with babies just like this, our staff went home after every shift, exhausted, hungry, and not sure they could come back and do it all over again. They had their own situations at home, lack of childcare, sick family members, and even their own coworkers fighting for their lives in our ICU.
1 minute.
Yet they came back and did it again day after day, because that's what we do at SMH. We take care of our community when they're not able to take care of themselves. Our community can count on us, and we take that very seriously. Their support at the beginning of COVID was overwhelming and meant so much to us. I worked at SMH for over 35 years. I've seen many, many changes here with unprecedented growth. The one thing that has never changed is the heart and soul of this organization, with the committed staff, physicians, and leaders that work here, especially during the pandemic. When we needed PPE, when we needed ventilators, we got them. Our leaders listened and acted. We learned how to pivot on the dime. Every single day, 24/7, 365 days a year, we're literally a little city within 10 seconds. It is difficult for everyone to keep reliving this life-changing pandemic. I, for one, have never been prouder of this hospital and how we came together every single day. The gallant effort put forth by the entire SMH team was bold, courageous, and fearless.
Thank you. Eileen Green, followed by Mr. I'm not really sure, Mr. Vogel and Michelle. Welcome, Ms. Green.
Good afternoon. My name is Eileen Green. I've been a resident of Sarasota County since 1978. I have never been to Sarasota County Hospital until a year and 2 months ago, when I had to have a biopsy on my lung. And I was told by the doctors prior to the procedure that I had to have a COVID test, and that most likely protocol would be that I would spend it overnight. I had the biopsy, and first of all, I had a test, the COVID test, and it was negative, of course, and they proceeded with the biopsy. Well, I had the biopsy, my lung didn't collapse. I spent the whole day in the hospital. They put a tube in my lung. And at 7:30 in the evening, they said, your lung is okay, you can go home. So they sent me home. The next day I was very, very ill. I called my doctor and I said, I can't breathe. He said, you need to get back to the hospital immediately. Came back to Sarasota Memorial. And they said to me, oh, your lung is collapsed. I said, fine. What do we do? Well, we have to put a tube in your lung again, but we have to do another COVID test. I said, why? I did not have COVID yesterday. They would have done the procedure yesterday. No, we have to do another COVID test. So as I'm lying on the table, waiting to have the tube in my lung, they do the COVID test and they come back and say, you have COVID. Well, we have to admit you to the COVID ward. So they admitted me to the ward, and then they told me, my pulmonologist came in and said, you need to have remdesivir. I said, I do not want remdesivir. I would rather have hydroxychloroquine. At the time, I didn't know about ivermectin. He laughed at me and he said, the procedure, the protocol, Sarasota Memorial Hospital is remdesivir. I now have kidney problems, liver problems, and heart problems. That's my story.
Yeah, Mr. Cobb, thank you. That's Greg. Michelle Nutter, followed by Gianni. Hilarious, I may have messed that one up too. Sorry.
Thank you for letting me speak. I want to apologize for my previous choice of words. I am man enough to make mistakes. Are you? I was telling a doctor to do no harm. When you choose to be a doctor, it's not to help people. And there's a lot of people here today that support the hospital, and I have no doubt the hospital is done great. From my perspective, it's during the pandemic. Yeah, pandemic, starting in October of 2019, your express plan. That's when we have issues with the hospital follow government regulated protocols, regardless of the medical benefits or harm. That includes remdesivir, for example. Tony Neville has actually quoted and promoted an Ebola study in Africa reached remdesivir. 53% of people in this remdesivir will be black. 6 months into this one-year trial, the independent safety board told remdesivir on the trial, said no one else can get this drug. It was too toxic and too deadly. We heard what this lady just said. What happened here in Sarasota? And this is from Tony Neville. They found that in 5 to 10 days of treating someone with remdesivir, 31% of all people kidney failure, multiple organ failures, septic shock, hypotension. So people have that. But this lady just said, a few days ago, and I'm switching topics temporarily, with the protocols of she mentioned PCR test. The creator of that PCR test, cardiologist, and neuro advice, said she shouldn't use it as a diagnostic tool. Here you saw what she said, it was used falsely to perform protocols on it that she didn't want. And you didn't let her have an option. To have an option. 2 days ago, Florida Surgeon General Rodolfo in Florida shared a official health alert and wanted to go with vaccine safety.
1 minute.
In Florida alone, there was a 17% increase in players reports that after the government database for harm to the vaccine after the recent COVID vaccine reported life-threatening conditions increased over 4,400%. My message to John and Congress, I recommend this one of the safety drugs that were in the FDA. It's been used off-label for nearly 50 years. We didn't come here to fill up seats, Mr. Hopper. We came to save lives. I thought that was your job. It's your job to save lives or to line your pockets. Like what's Manuel Portillo raised $1.5 million for general in 2021 alone. Are you in it for the money or are you in it to save lives?
Thank you.
Chair, I'd like to take point with that. You gave direction to this entire audience to not use this opportunity to defame any individual, and I think that violates one of the principles you set forward for us.
Your point is well taken, and I'd ask that speakers refrain from attacking individuals.
Tax on their Facebook page, nice.
And Mr. Cobble, thank you for your apology your first meeting. That's very noble for you to do that, but please don't attack. Okay. Ms. Nutter, followed by Gianna Peters and Laura Hall.
I am Michelle Letter, single mom with 3 boys serving in the U.S. Navy. Can you hear me?
Yeah, speak into the microphone.
Well, I'm glad to. Is my time starting again?
We'll start it again.
Thank you very much. I appreciate it. My name is Michelle Utter. I'm a single mom with 3 sons serving in the U.S. Navy. And I'm also vaccine injured by Pfizer. I'm also a healthcare worker. I work the front lines. I did everything that I was told to do, even the mandates to get the vaccine. I was reluctant to do it, but between my job being single and also having 3 kids in the military, I had to get it just to see them and also to keep my job. My life changed after I took that vaccine on January 11th, 2021. I became very sick 40 minutes after. I had flu-like symptoms. Ended up the next day unable to get out of bed. Waist down, I hurt. Pain levels more than 10. It spread to my arms. Weeks later, I ended up in the hospital. They thought at first I had Guillain-Barré syndrome, but I'm being treated for CIP. Sorry, chronic inflammation, demyelination, polyneuropathy. I'm nervous. During this time, I've had MRIs in the hospital. I've had nerve conduction tests, 3 of them, small nerve biopsy, and tomorrow is my anniversary of 21 months of IG infusions where I sit 6 to 10 hours alone being infused. Believe me, I have plenty of time to realize that I should never took this vaccine just for the mandates. I am censored on social platforms and taken down, but it's bad enough I'm a healthcare worker, and I'm censored at work. I'm told I'm not allowed to talk about vaccine injuries or I will be written up. I have a target on my back, and I don't appreciate it. Doctors ignore us, and we do not get the treatment that we deserve. We are turned around and gaslit. Doctors don't want to treat us. Is it because you're scared to lose your license? We deserve to be treated. We shouldn't have to travel miles away to be treated for vaccine injuries. This isn't right. I never asked for it. My own son is serving in the military. Right now he's being looked at for cardio issues because of getting the Pfizer vaccine. He's 25 and healthy. I was healthy before I took this vaccine. I am asking you, you have taken a Hippocratic oath just to help us. You're to treat us, to treat the ill, to the best of your secrets of medicine for generations. If this is what you're doing to us and not being able to treat us, I question what the generation is going to be.
Thank you, Ms. Sutter. Sutter, where you work here at Sarasota Memorial Hospital, which hospital do you work in?
I work outside of Sarasota.
And where do you work outside of Sarasota? I would like to know.
I would be glad to tell you in person. Legally, it's not in my best interest, but people know what I'm going through. But the vaccine injured need help from the doctors who are tired of being turned into gas.
I would offer here, if you need your help here. Thank you. Next is Anna Peterson, I believe. followed by Ms. Laura Hoffman, followed by Richard Marks.
My name is Gianna Palermo.
Palermo.
Sorry, a lot of people. I am proud to serve our community as a Sarasota Memorial nurse. In 2018, Johnson & Johnson created a commercial that brought me to tears of pride. The transcript is as follows. During the Korean War, our soldiers died from infection and in battle, until a nurse introduced sanitary practices still in use today. When the surge of polio hit the world, it was standard practice to strap down and immobilize patients, until a nurse discovered movement and physical therapy had far better results. In the 1950s, jaundice was the leading cause of death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread, so patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. Disease taking our loved ones out is not a new concept. It is easy to look at these solutions now and judge how silly the healthcare system community was for not putting that into practice. We don't know the answers to problems until we have data to prove interventions are working. The same can be said when COVID cases are on the rise and steadily increasing. Our hospital used present knowledge from the CDC to structure and care provided. While we learned a lot in that short amount of time, there's still so much more for us to know about the virus. If you're unsatisfied with these results, I challenge you to join the healthcare system and see what providing patient care looks like. We lost many of our own during the pandemic as well. Our hearts want to find an easy solution, but it requires people willing to work towards finding the answer. In addition to losing our own loved ones, we lost yours. On one of my work days in 2020, I held the phone for my patient while her and her husband said goodbye, after she was told she likely wouldn't come off the vent. I spent 30 minutes cleaning the parking garage before it was safe for me to drive home.
1 minute.
Imagine willingly showing up each and every week to carry out their service. Healthcare workers find no satisfaction in losing a patient. Labeling us is not the solution. We are not the enemies. We continue to show up each day because we want to help, not hurt. Please don't forget that.
Laura Hartman, followed by Richard Marks, followed by Mark Elm.
Thank you for this time, Board. My name is Mark Hartman. I am a concerned veteran for America. I am also a daughter of a Vietnam veteran who receives care from community care through the VA hospital here at Sarasota Memorial Hospital. According to the Washington Post, Senator Rand Paul, the Republican from Kentucky, I'm aware, I apologize. He filed paperwork late showing that his wife, Kelly Paul, invested in Gilead February 2020. The pharmaceutical company that makes remdesivir. So as a combat veteran, I got out of the military, went to nursing school, I hold a BSN, I do not hold an active license, and I do not think politicians have a right in healthcare. If this inside trade is pushing remdesivir, that's financing hospitals, I'm going to have a problem with that. When my father receives care here, I'm concerned. I'm highly concerned with the lack of transparency. I'm highly concerned with the ability that we can continue to be censored. The fact that I hesitate to use his name out of respect that I am aware it is going directly after him. However, that is accountability. When there's inside trade happening with remdesivir, we don't know this, and we don't know the outcome of high doses. So I volunteer at American Frontline Nurses to advocate. And with advocating, that also means working closely with congressional offices to understand how we can move forward and what personal option looks like, and what personal option would look like in Sarasota County. Thank you for your time.
Thank you. Richard Mark Elman, followed by Sydney Hoffman.
Prior to retirement from medical practice about 9 years ago, I was consulted by a defense counsel on behalf of hospitals and doctors. Our healthcare industry and institutions have lost much trust and confidence. A multi-billion-dollar PR campaign was deployed to program and confuse many people and many doctors to subject themselves to untested injections, shots that were either effective or safe. Fearsome statistics and images were projected daily, and demands for compliance to illogical and damaging measures came from the CDC and others pretending to be compassionate, diligent, expert. Pfizer and the FDA fought in court to hide the dangerous truth about their gene-altering injections, while billions of dollars were being extracted from the middle class and transferred to those who were already wealthy and powerful. Jobs, careers, reputations were threatened unless they adopted the approved doctrine. What is left in its wake are many thousands disabled and dead in economic and societal ruin. What was done to the children was grotesque. The fundamental mission of public hospitals is to serve the public. Trust is fundamental in the delivery of safe, effective health care. It will take heroic efforts by the hospitals and related industry to restore. The preservation of the sacred doctor-patient relationship is key to restoring that trust and must not be invaded by corruptible third parties. In your website, you state we believe people can make better health decisions if they have accurate information. It's time for a detailed assessment and analysis would occur. While the wheels of justice slowly winds its way through the industry, the public has a right to see it all. To restore trust, an open access platform must be made available so people with their chosen experts can look at more relevant indicators that demonstrate that safe, effective care has been delivered. In your November meeting, you trotted out your physician leaders that were clearly very highly trained, very hardworking, and very passionate about staying current. But that doesn't answer the question. How could they miss the early signs of vaccine injury? They were apparent to many, many people early on. How could you send out videos encouraging pregnant women to get vaccinated? What's that? Why would you use remdesivir when ivermectin was available and known to be effective? New buildings look great, record revenues sound great, and pretty buildings for high revenues equate with good, sound medical care. It's imperative that an alternative platform for hospital care with a new payment scheme be carved out of the existing system that is totally independent from the monolithic, highly corrupted system that now clearly dominates much of the decision-making we would see. I strongly suggest a special task force of health leaders, legislators, payers, and others to immediately begin to make so.
Thank you. Delman, followed by Sydney Hoover, followed by, I think it's Mr. Jordan.
Good afternoon, I'm Mark Bellman, I'm the Director of Respiratory Care Services here at Sarasota Memorial. Permit me to share that while I'm disappointed, somewhat dispirited, by the necessity that I stand before you today regarding and defending the outstanding patient care provided by the team here at SMH, especially regarding the excellence of our respiratory therapists. I very much appreciate the opportunity to do so. SMH was out front in our response to the pandemic. On September 9th, 2020, I shared an alert from the CDC with the respiratory care team regarding what would become known as COVID, warning them to be on the lookout for this disease. With the administration leading the way, within a matter of days, we're planning their response to how best to care for COVID patients. The extreme importance of both supporting the health and well-being of the community and protecting the safety of our team of caregivers is always taken into account. Proactively require additional equipment resources, such as higher flow oxygen devices and ventilators. Thus, as the rest of the country clamored for this equipment to provide care for COVID patients, we were already at the front of the line, seeing how important that is. With the arrival of our first COVID patient, our plan was immediately put into action. Our team, fearful for their personal safety and the health of their loved ones, did what they always do. We stepped up to the front lines of the battle, working with physicians, nurses, partners, and others, who quickly ascertained effective treatment strategies. When the American Association for Respiratory Care sent out their guidance document regarding COVID, it was as if unwritten. We didn't stop there. As leaders in research and treatment, we learned and made adjustments at the time. We nimbly responded to the changes that each COVID wave brought, while sharing our findings openly as time to dedicated healthcare workers. I'll share one story in hundreds. There was a gentleman in our ICU who, despite his COVID, required ventilatory support. Before placing him on a ventilator, we stood by him as he spoke to his family and children on an iPad. He did so with almost certain, but also with the realization that this may be goodbye.
1 minute.
Because I've been in for weeks. And there were a number of days when it looked like that would be his last. Well, he and our team fought with strength and perseverance to make this happen. And I remember this far as it was yesterday. I was in my office early one morning, shift changed. The night shift was filtering back to the respiratory care department. I watched him go by my office door. What I witnessed was a parade of rejoicing. He made it. It was with this amount of dedication and genuine care we treat each and every one of our patients. We rightfully get excited to cheer when our favorite football team executes a successful 2-minute drill or our basketball team gets a buzzer beater to win the game. Are they perfect? No. Are we perfect here at SMH? Certainly not. Yet, along with arguably all consistent hits, excellent teams strive for perfection, continuing opportunities to improve. It is not merely a game mistake. I have the honor and privilege to witness here multiple times a day after day after day,
Thank
that
you,
we
God.
are performing excellence. This team deserves nothing but accolade.
Thank you, Tom. Speaking of Oakford, I think I figured it out. Sarah Jordan, followed by Carolyn Johnson.
Thank you for the privilege. I'm Cindy Holland. I think that's who you're referring to.
Please forgive me. Your handwriting is. The doctor. All right, start the clock over. Sorry.
Again, thank you for the privilege. I'm a licensed Florida physician who worked in Venice Hospital, the old Venice Hospital, for 36 years as a general and vascular surgeon. I also come before you as a patient. During my time at Venice Hospital, I founded and chaired the Surgical Quality Assurance Committee and chaired it for 20 years. I've also volunteered for the state of Florida Department of Health Expert Witness Program, where I served voluntarily to review cases for the Board of Medicine. In 2021, I volunteered for the Sarasota County Health Department, giving over 2,500 vaccinations. I have been vaccinated. I have had COVID. I have been a patient in Sarasota Memorial Hospital in December of last year. As a citizen of the county, I've attended numerous board meetings. So I have several observations. One, the hospital personnel are not the enemy. You and I, potential patients and citizens, are not the enemy. Disease is the enemy. Two, disease is, and you need to know disease is an equal opportunity assailant. It doesn't care if you are pro this or anti that. Three, we are all human beings with our individual flaws, as are the people in the Sarasota Memorial Hospital system. But like we in the medical field, we all strive to improve and be better. Four, let us disagree and debate, but with respect for individual dignity and with civility to help make our hospital system already one of the best in the nation, to likewise become better. Five, because when the day comes that our common enemy, disease, comes assaulting us, let's be ready to pull together to give us the best chance of survival.
1 minute.
For we're in this all together.
Thank you, God. Am I right? Is it Sarah Johnson, Jordan? Sarah Jordan. Okay, terrific. I did get it right. Followed by Carolyn Johnson, followed by Jennifer Cottrell.
Thank you, Board, for letting me speak. My name is Sarah Jordan, and I'm a critical care RN here at the esteemed Sarasota Memorial Healthcare System, and I want to thank you again and the rest of the community. On behalf of the critical care team, specifically the nurses, I came here to be the voice of brave, compassionate, and innovative individuals that I've worked alongside with throughout the pandemic, especially the Delta wave. Our team of nurses, doctors, respiratory therapists, pharmacists, and techs were the ones on the front line of this war called the novel that was waged by the novel coronavirus. And just like the great military forces that defend and protect, So was our command center, championed by Dr. Gordillo and executed by our amazing critical care intensivists, who received the intelligence and evidence as it was being captured live by the CDC. I am quite sure Dr. G did not sleep for 2 years. He was with us every step of the way. He held our hands, we held your loved ones' hands, and we fought together to serve and protect. CDC is the nation's health protection agency whose mission is to protect America from health, safety, and security threats, both foreign and domestic. This virus is a foreign invader. To accomplish this mission, CDC conducts critical science and provides health information that protects our nation, our community, against dangerous health threats and responds when analyzed, and that is exactly what happened. And what we did as a Sarasota Memorial Healthcare System that serves the community and beyond as a critical access facility, we listened to this advice and recommendations from the experts who deal in evidence. And evidence is the only thing that truly has something to measure against. But why do I state this? Because I know the scrutiny that we are under. I know that we locked this hospital down and did not allow family in to see their loved ones, to hold their hands while they took their literal last breath. We could not. We had to follow the guidelines because we were on that front line to serve and protect. That is because we have to protect those who are vulnerable or something jobs to do, to protect the healthcare workers so we can continue to deliver the care required to save lives. We had to ensure that those not been exposed to COVID-19 were not exposed by the public. And do not forget, we still had to take care of patients with heart attacks, emergency surgeries, trauma patients, stroke patients, ruptured gallbladders, those that got into car accidents, those that needed medical care outside the surge of COVID-19. When this virus launched its attack on this country's soil, we had no clue what it was. It continued to elude us. It changed its armor, created a new plan of attack, and declared a whole new horrific conflict, the Delta variant. There was a word my colleagues and I will never hear or say without a deep sigh or a pang of pain, and that is surge. The surge of patients that came into our hospital unable to breathe in July of 21 swept our ICU and it was like anything we've seen. COVID-19 attacked young, healthy people, women who were pregnant. It did not discriminate. We opened our doors, finally, we allowed families in. And we will do it again.
Yes, thank you so much. Carolyn Johnson, followed by Jennifer Cottrell, and followed by Joan Collins.
Hello, my name is Carol Johnson. I'm a 50-year resident of Sarasota. I have family who've been physicians at this hospital, and I've been a lucky patient. I've had great care. But I've come here today to express my dismay with the politicization of our carefully built and lovingly nurtured public institutions. Our schools, colleges, universities, some businesses, and now possibly our beloved hospital are under attack from the ambitions of our governor and some members of his political party. The goal is to prevent dissension while subverting the democratic process. Dissenters, please leave our wonderful hospital alone. Take your disrespect for science and modern medicine somewhere else. We have enough challenges ahead. We have future pandemics, climate change, sea level rise. We don't need manufacturing crises. We don't need these kinds of fights. We need unity behind the purpose of good medicine and quality health care for everyone. Thank you.
Thank you, Ms. Johnson. Please refrain from interrupting the speakers. Everyone is due respect. Next speaker is Jennifer Cottrell, followed by Jim Collerton, followed by John O'Duffy.
Good afternoon. My name is Jennifer Cottrell, and I'm a Sarasota resident and taxpayer. I come before you today to support those families that lost loved ones due to the actions, or should I say inactions, of this hospital. Unlike some of you, I listened to those families tell their stories, and my heart broke for them. I couldn't even imagine how I would feel if that was one of my loved ones. I have sat here for the past few months and watched the majority of this board sit with cold heart as these people spoke. Some of you were more concerned about your fiduciary responsibilities than you were about the loss of human life. The tactics that some of you and the doctors used to silence folks spoke volumes to this community. You packed this place with doctors a few months ago to try to keep hearing these families tell their stories. Do you even realize how hard it is for these folks to stand before you and recount what they went through? Then prior to this meeting, Dr. Hopberger puts out a message to all doctors to pack this auditorium today in an attempt to fill the seats so that folks like us cannot attend. That is a slap in the face to every single person that lost a loved one in this hospital. There are a few things to make a good doctor. Two of those are compassion and honesty. Compassion is one of the most important attributes of a successful doctor. We are lacking that in this room today from doctors and from some of you board members. The second is honesty. A great physician is honest with patients and informs them completely and honestly the injury from medical care. Do you hear that honesty, not cover up? The mere fact that you would assign this investigation to the Internal Quality Committee is a complete and utter fail on your part.
1 minute.
The majority of this board did not take this seriously, and it shows in your actions. I don't know how you people sleep at night because your actions or inactions should haunt you each and every day. But we don't have the right to judge you. There is only one person that can do that, and that's the man upstairs. And when that time comes for you, I hope he shows you more compassion than you showed the families that came before you in this very room. This doesn't have to end like this today. There's still time to give these families some healing and stop community outrage. It's time to stop the horse and pony show, and let's get a proper investigation done. It's time to assign this to the special committee, other than your internal quality committee, to perform an in-depth and thorough investigation. Thank you for your time, and God bless you all.
Jonathan, followed by John O'Duffy, followed by Kristen Marcus.
Thank you, ladies and gentlemen. I think I was sitting here thinking I've probably been to more board meetings than all of you put together. Of course, except for Greg Carter. I've been associated with Sarasota Memorial in various capacities over the last 50 years. I've been associated with a number of professionals here. I'm extremely proud of this hospital. All the members of my family have been patients here. I was thinking, listening to someone, I was one of those patients that was denied my spouse being at my side and had to stay out of how terrible it was. On balance, you should be very proud of Sarasota Memorial, its medical staff, its nurses, and its technicians, and frankly, right down to the fire bottom of the hospital. It's wonderful. It stems from the leadership of David Berender and his administrative team. I think they're to be commended. And the personality of the hospital is reflected, I think, coming from David. I was thinking also, Dustin Thomas, our Excel winner here, is an excellent example. And one of the things I do say to Excel winners when we have a reception every year or two is I feel like I represent the community at large in thanking them for being the personality of Sarasota Memorial, which is a commendable personality. The other random thought is that I have was that I think the report was excellent, and I think it was very well done, in depth, and great analysis. I look forward to reading the report. I commend Connie Anderson and Gene Lucas, the nursing directors here. You know, I was thinking some hospitals work to get a recognition as a magnet nursing center, and how many do we have in row 8 or something like that?
One minute.
That's enough. Thank you very much. Godspeed.
You. John O'Duffy, Kristen Marcus, followed by Erica Workers.
Thank you for inviting me.
Please speak into the microphone.
All right. I came down here from the Mayo Clinic in 1999. I was in the staff here for 16 or 17 years, professor of medicine. And COVID-19 doesn't care what your academic record is, it will get you. I was waiting for it. So I'm a retired rheumatologist, but I go to clinic here where they have free medical care. And I attend there a couple times a month, and I'm happy to do that now. October 2016, fever, positive test. Come to the hospital if your temperature goes above 102, or if your O2 sat goes down to 92 or below. Both happened on Monday morning. I drove in, parked my car, they wheeled me up to put a red cap on my head. I'm Irish, they should put a green cap on my head. They wheeled me up to the unit after they did CT scans that showed that I had abnormal lungs, I had infiltrates. So then it became the question of treatment, and I had done a lot of reading, and I was stubborn. I knew what I needed. There was a new antiviral out there. There's nothing else except oxygen. So I wanted remdesivir. I didn't know this was a controversial subject that would come up here. So I wandered my way to get remdesivir, and I qualified. I got the first infusion the first night. My temperature the next morning was 98. I felt better, somewhat better. You have to stay in for 5 days. Every night I got 1 hour infusion. I came out the next morning and told him I wanted to go home. And Dr. Right here. He's good. He's good. They let me go, and so they let me go, and I drove home in my own car, which I found in the parking lot here on the issue. So I attribute my ongoing immediate existence to remdesivir. That your take from my talk is get treated, be smart, read about what's good, get tested, bug the doctors or the emergency room if you want to get fixed.
Thank you, Doctor. I know Doctor is going to get Kristen Marcus, and Erica Marcus, followed by Joe Allen.
My name is Erica Warvis. I'm another basement past today, time, which did recently move here at our recommendation because this hospital is a great hospital. And I want her to be. I'm a resident physician. I graduated in 2020 and came here at the start of the pandemic. I helped to create the COVID-19 order set that we use in ER. I was there when we knew nothing about what was coming. And I've also been through all of the hospital units as a result of being a resident. We have great staff, and I'm proud to be a part of this hospital. There was a time where we didn't know that we would have resources to care for all the patients that were in need. Time where we did not, and we made the changes. This has been an experience for everyone, but this is a great hospital, and even if I do not stay here, I would want my mother to receive care. Thank you so much.
Thank you, Doctor. Erica Marcus, Joe Allen, and Bettina Entiga. I probably messed that one up too. So, is Erica? I had two parts. Okay. Joe Allen. Going once. Going twice. All right. Bettina Antigut, followed by Dan. I'm terrible at this. Anna Skew, the handwritings are rough. And we're making grades. What are yours?
Hi, I'm Bettina Inns.
Thank you so much for helping me with that.
Okay, I'm not here for myself, I'm here for a gentleman that was here. His name was Edward Marin Colorado. came here into the ER February 17th, 2 years ago, 2021. He had been given a diagnosis of pneumonia. So they admitted him, and he had a life with his family and friends that was stolen. 27 days later, March 15th, 2021, he died. His diagnosis was pneumonia. Pneumonia. So, 4 months later, I got sick. I went to the clinic. I was diagnosed with pneumonia at 67 years old. So now, there's like 30 years difference between us. I went and got the antibiotics, the steroids. I was trying to 5 days. I know doctors make mistakes, they're not gods. I know Dr. Duffy saved my mother's life because she's misdiagnosed with rheumatoid arthritis. I took her to him, and he said she doesn't have rheumatoid arthritis to go off those meds and save her life. She only had osteo. And so doctors do make mistakes. But I am here today, and Edward's not. And I feel for his family, and that's why I'm here to ask that everybody make sure that they investigate protocols that cause these deaths. Pretty soon, our president is signing over our rights to who? Right now, that we have rights, that they will govern us. We are Americans, we don't have a constitution over us, but who is going to be dictating how we operate on a medical profession? Thank you for your time. Thank you for letting me brief.
Dan, Honest Few, followed by Wendy Williams, followed by Sharon Smith. Help me with your last name, please.
N-I-S.
Welcome.
N-I-S. Thank you.
Welcome.
I'm a local retired architect. Actually, I met a lot of your board members. This is the first time I speak in front of the board. And it's my opportunity to thank the medical staff for saving my life during the COVID. I contracted COVID in late June 2020, and I was in the hospital for 5 months. I think I'm one of the longest COVID surviving patients. I was intubated for over 55 days. And even today, I'm following physical therapy, process, you name it. At one point, I was making it completely, so they do intubation. That's create some complications, but I survived, and I'm very happy and very thankful to Sarasota medical staff. And my view on COVID is that the way the hospital has performed their duties, that we doctor run a lot during wars. So because that when on the front line, you see injuries and you see different or horrible aspects that need to be brought by the war. This was a war waged by the virus, and I think that the physicians and nurses, they all learn more and they're better prepared for the next 1 minute war. For 5 months, I think I heard the lullaby 1,000 times. And that's one thing that I like. And it made me very emotional, actually, because my 2 daughters were born here. Also, I want people to know that when you've been together for a long time and you're isolated, the PPEs are very important. And I was holding not to call the nurses in order to save their PPEs. But I know that troops will come to the walls and nobody will enter the room. So I hope people understand that this is a very serious, was a very serious crisis, and especially after I came out of the hospital, the Delta variant came just a lot more. So thank you very much.
Thank you for your comments. Wendy Williams, followed by Sharon Smith, followed by Donna Mock.
Good afternoon. My name is Wendy Williams. I am a first responder. I'm a firefighter paramedic with 23 years of experience. I'm a mom of 7, Marine Corps veteran, and I was on the front. I am probably not the person that's in favor of this, so that's why I'm here to give a voice to those that are not. Those that are injured can be here to speak, those that are dead cannot. We all have protocols to follow, but I will tell you that efficacy is not in one medication. In any medication that you have or take has an adverse or potential side effect, and those effects should be considered. I have a healthy son, the oldest, very healthy, military. He did get vaccinated, and he is now vaccine injured, as well as my daughter-in-law who's a nurse. And nobody here can tell me that they were not affected or had an adverse effect to this vaccine. I know my children. I know what foreign substance was put in their body, and I know what the efficacy and the effects that it actually has, because when the shots were first given out, I transported vaccinated COVID positive patients. What I am telling you is this, and I'm here only for this, is that at the fire department, we are held accountable for our actions. We do it with integrity, we do it respectfully, and to those that are not here to speak, the voices should be heard by their loved ones that are here. I am disgusted with this as pandemic has done to my children. I am disgusted because our oldest son will never get a grandchild. I am disgusted at the damage that's happened to my loved ones personally, and I'm disgusted what's happened to the community. I applaud all the nurses, doctors, and first responders that gave their best to do what they can do. But I will tell you this, that we all have to follow protocols. Those protocols are from the top, bottom, delivered. And there are things that I've had to do, withhold treatments that did not fit the parameters of the protocol for this pandemic. This is what we need eyes on. We need eyes on the needed change so that this will never happen in the future. We need eyes on our own accountability. We need eyes on people like my son and my daughter and all the people that have lost loved ones. You can sit there and say, and give your experiences of your survival, but that's not why we're here. That's for 1 minute. But what we are here for, and what we should be here, is the attention to details where we have failure, where we have loss, and that's how we become better. And without acknowledging the loss, without hearing the words, there will never be accountability. And that's the only way we progress. That's the only way of the future to being able to save lives and to keep us safe. Thank you.
Sharon Smith, followed by Donna Moffett, followed by Vicki Nice-One. Ms. Smith.
Hello, I'm Sharon Smith, and I am my husband's voice. My husband was killed in the hospital by uncaring healthcare workers using the deadly CDC COVID protocol.
Ms. Smith, may I interrupt here? Was that here in this hospital?
Doesn't matter.
I would appreciate if you just.
We can talk about this privately if you'd like to. Right now, this is my.
They order in this room, please. So, Ms. Smith,
Thank you. Using the deadly CDC COVID protocol, which includes remdesivir. For what reason? Money? I'm asking you to end the deadly CDC protocol that is still being used in the hospitals, including this hospital, I'm sure, today. Your prayer at the beginning of this meeting was great, but now you all need to live it. Do the right thing. Because God is watching each and every one of you.
and he knows all.
Donna Moffett, followed by Vicky Nice-Wonder, followed by Saul Kilston.
My name is Donna Watson. I live downtown in Sarasota. I'm a refugee from Los Angeles. Okay, can you hear it? I have to say that I don't think anyone really can fault the staff for trying to care for patients. I've had experiences with Sarasota Memorial Hospital. Well, I haven't, but my husband has. Our first experience though with COVID was my cousin's husband, who's 72 years old, was admitted in April of 2020. He was one of the first people to die here. After he went to the hospital, she was never able to see him or speak with him again. That's 50 years of marriage just disappeared. It was kind of a horrifying experience, especially early on, we didn't know what it was. The treatment that she thinks he got seemed to be very good, but how do we know? No one was there. In August of 21, my then 87-year-old husband had a fever break. He was brought to Sarasota Memorial. He had a fabulous surgeon. Problem again, it was another COVID lockdown. I was unable to visit, unable to be there for him. That's never a good thing when a patient is in a hospital without an advocate. No matter how good the staff is, they're overworked, they're understaffed, they don't have time to love your loved one the way you do. I got him back, he was in kind of rough shape. Your rehab center is amazing. They did what they could for him, he did very well. He came out of it, then in January of 22, at 88, he contracted COVID even though he was fully vaccinated with Moderna. At that point, we had a choice. We either bring him to the hospital or we try something different. If he was going to die anyway, like my cousin's husband, the decision was he would die at home with someone that loved him. Fortunately, we have a doctor that was willing to try an alternative treatment. We used ivermectin and whatever the FLCC protocols are. I cared for him at home. Second day until he fell out of bed, lacerated his hand from finger to wrist. I called her, I said, maybe I should take him to the hospital. She said, no, bring him in the office. She stitched him up, 22 stitches with COVID. He had low oxygen, brought him back home, continued the treatment. He not only survived, he's in better shape than he's ever been. He will be 90 years old in May. There are miracles and there are alternative treatments. I'm only hoping that the hospital opens their minds to the fact that there's more than one way to skin a cat or a cow or whatever that is.
20 seconds.
Thank you. And the gentleman, the nurse that said the nurse brought in hand washing was wrong. It was a man named Igor Semmelweis. He actually died in an asylum. They threw him out. They didn't listen to him. So even the smallest ideas can be very successful. I hope you open your minds.
Thank you, Smith. Vicky Nice-Wonder, followed by Saul Kilstein, followed by Carl Johnson.
Vicky has already left.
Okay, Vicky is gone. Thank you.
I'm Saul Kilstein. I'd like to first take a moment of a point of personal privilege. We heard Anthony Fauci vividly and repeatedly related to Joseph Mengele, the angel of death at Auschwitz. As a Jew living in this community, I find that outrageous, offensive, and I hope the board will not accept that reference again during these hearings. And I just hope that in this community, anti-Semitism is not accepted in any form.
Thank you. Really good.
I've been in the health field for over 40 years at the federal level with Robert Wood Johnson Foundation. I ran Medicaid in New Jersey, and I handled public policy for a major pharmaceutical company. For me, evidence and science is what drives healthcare. For me, what you do in training, in research, and in healthcare is what brought me to Sarasota. while individual cases, unfortunate outcomes, shares emotional grief, we cannot have the work of this institution driven by individual anecdotes, conspiracy theories, and other types of information that cannot hold up to science. I think the research that the committee has heard today, the evidence that you've collected, emotional information can often take the headlines, sound bites in our current digital environment, get the attention, but at the end of the day, a research-driven institution like Sarasota Memorial Hospital is what brought us to this community 5 years ago, and I hope it will be what sustains this institution over time. Thank you very much.
Thank you, Jeff. Carl Johnson, followed by, there's like Rocky, Critton, I'm sorry if I messed it up, followed by Aaron, and this handwriting was good. Real Kelly, I must say Kelly. First name's Earl. Okay. Sir, you're Carl Johnson.
Thank you.
You have the floor.
Thank you, board and chairman, for taking this time to hear the voices of those of us who live here in this community. I'd also like to take time out to thank all the medical professionals, from board lead to the most senior engineer in between. I'm an indicted user of these hospitals, so are some of my people that are here with me. We appreciate you. We expect that type of care here because we're from here. We would expect nothing less than that. What I'm here to talk about is I represent the American Project. We're a nonprofit organization. We're one of several organizations here today that are standing here before you as social welfare organizations here for the people. We provide a voice, and part of the voice we provide is to reference things. And I heard it talked about before, medical freedoms. We do represent, where I come from, one of these organizations that do a lot more than us here in Florida, medical freedoms. I hope you understand that when we talk about medical freedoms and other rights, that we're not put in a box. And I see some of that going on here. We're just saying, let's not do that. Again, we're Floridians, let's stop that. What we're talking about is the scientific method. We hear the word science thrown around here a lot, don't we? But we know from CDC, food, NIH, those will both spot. So we're good. I don't have to have a science degree, but I'm trying. I don't have to have a resident PhD and MD for me to make a decision, personal decision for the patient, for my care, for my family's care, anything regarding COVID care. If we ask ourselves, referencing science, because we do that a lot. I'm going to say as COVID care protocol, let's ask ourselves this. We've also explored, we have wonderful stats right there on the screen. We also see how much of a weighted effect that might have in relation to their deaths that come with COVID care protocol. I think you're going to hear some stories about it here, that there are other numbers that result from COVID care protocol, and it's not recognizing that there are other alternative prophylactic care treatments that intensely personal patient decisions should be made. That's what we're asking for, that's what we represent. Respectfully and humbly, we don't have to do this, we get to do this. So I can't represent medical freedoms, I'm proud to say we do. That's more than just putting stuff online, that's more than saying everybody here doesn't know what they're doing. We're looking for the right answers, and we know that the doctors want to do that. So the next time we have a public health crisis, we're a little bit smarter, a little more educated in that process. That's what my organization does, and both of us like us. Thank you very much for listening.
Thank you for Rocky Critton. Again, I apologize that, go Rocky going once, twice. Rocky's not here. Aaron, and yet the handwriting, I cannot read it, from Venice, Florida. Is there an Aaron or Irwin? She's coming down. Followed by Hattie Myers, followed by Ruth Brandywine. And please, ma'am, tell me your last name.
Free.
Thank you. Could you speak into these? Thank you.
My son was 39 years of age when he had pneumonia and ended up
in the hospital when his wife and him realized that they were going to be admitted. They were very adamant about not being on the hospital, which was their best year. And preventing because they had known many people, pretty actually. And they knew this, so the hospital protocol, and it was not allowed. We weren't allowed with him. He was alone. He was alone. The hospital that was supposed to be a place of healing turned into a prison for us. My son's wishes and our wishes were nothing. We had a prescription of ivermectin that was very hard to fill. We finally got it filled, we brought it in, and they refused to. You know, and it's like, where is the team anymore? There's no team. It's like doctors are making these decisions for all of us, and we need to have a medical team once again. We went to, my son, actually, when the doctor did find out that he was not supposed to be on, because we had asked him not to be on that, he said that he would take them off. They did not. Then they walked out and said we were not allowed with him again, but they said his organs are failing. He's 39. What do you mean his organs are failing? It's a side effect of medication, is exactly what he said. We asked for ivermectin. I had my lawyer on the phone. I had a prescription in my hand, handy. They refused to use it. When we went to go the medical records, my son, 39 years of age, with 3 children, 8 siblings, we were all crushed. The attendant at that room, when we went to pick him up, no cost to you, please do something about this. They're killing people. Please, here's my cell number. I am in here and I am absolutely filling in. Please do something about this. And she hands herself. My heart, many heart, you know what? All these nurses and doctors, I know we have medical people in our camp. I know how hard people work. I know it. But you know what? The CDC protocol is killing people. And until we wake up and realize that that is what is happening, we have choices, decisions that they, for each of us, we have the medical freedoms being thrown out the window. We have choices that are not being made and not being met. Thank
Okay, my heart hurts. Could you, maybe after this meeting or at some point, I'd like to know your son's name and the attending physician, and perhaps we could follow up with you because I would love to have that looked at. Would you please? Thank you so much. Kathy Myers, followed by Ruth, Brandon Wine, followed by Elaine Erda. Yes, ma'am. You got the floor.
My name is Patty. I am a Florida girl born and raised. My husband was murdered in the place that I thought would help him. He was refused many treatments because the doctor said, quote, those are not known to work, or quote, those are not science-based, or quote, that is outside the protocol of the CDC, the FDA, and this hospital has mandated. My husband was only 55 years old. He hardly got ice chips, water, and they stopped food the last 5 days. I'm sure most of you all have spouses. Imagine if your spouse was suffocating and professionals all around you kept saying, quote, there are no more COVID meds. They didn't look up at you. They kept typing on their computers. When asked to get simple ice or water, they said, quote, we have a lot of emergencies. This could have ended differently, but you all decided he wasn't going to make it and he was, quote, treated that way. It's shocking that high-dose vitamins were not approved or allowed. Why the hard push for almost 3 weeks to be vented even when he was on high flow at 30%? Why did the ICU doctor tell me we should have put your husband on the bed when he was doing better? That's crazy. This hospital committed 2 crimes. One is intentional misconduct, and the second is gross negligence. They stopped the medicine that was healing and gave him medicine that shut his organs down. They gave him so much oxygen it flooded his lungs. They gave him lots of anxiety meds that slowed his breathing more, and in the end, so much propofol and fentanyl that he was never going to come home. He saw so many body bags pass his room. Don't kill more people. Enough is enough, and you've been making a killing.
Ruth Brandenblatt, followed by Elaine Perna, followed by Melissa Rack. Going once for Ruth, twice for Ruth. Are you Ruth? Okay, Elaine, you have the floor. Thank you.
Thank you. I am a retired clinician and also a retired quality specialist. I retired from Memory Healthcare and moved to Sarasota in 2017. I know how difficult in a non-pandemic situation it is to improve one's quality metrics, especially when you are comparing yourself to the best in the nation, such as using a premier database or a clinical registry like the STS, which SMH also uses. I'm here because I'd like, especially the lay people, the lay citizens in the audience, to understand that these are the best ways to conduct a quality report. I look forward to reading yours in detail. That is the best way to do it. I also recognize fully that part of the methodology conducting quality reviews includes looking at outliers, such as some of the terrible examples that were cited here. And I'm sure that part of your process has included looking at some of these outliers and that you will continue to do so. Kudos to you because your performance on these metrics are truly outstanding. And I am proud to now be a Sarasota citizen and you are my hospital. I was also a patient here during the COVID pandemic, although not for COVID, and the care was great. Thank you.
Thank you so much. I'm going to take the experience of Dr. Seaman, would you come outside and see if you could speak with the woman Earl, who spoke 2 times ago, and also Ms. Myers, just to see if you can comfort them and maybe relook at her case. I would like to have some follow-up on that, if you don't mind, Dr. Seaman. Is she up there? Oh, you want to say? Okay, please. I would like to follow up on both those cases. So thank you, Dr. Seaman. Okay. We are at Melissa, followed by Shirley Weinstein and Dr. Stephen.
Good afternoon. My name is Melissa Radovich, and I'm an anti-COVID vaccine. Absolutely. I don't believe in the vaccine. I don't support it, and I'm proud of that. And what is so scary to me is that half the room is talking back there behind the back. It's ridiculous. I feel like I'm going to be attacked for picking a side here. That shouldn't be the case. It shouldn't be doctors versus patients. We are not each other's enemies. I decided to speak after a friend sent me a collection concerning social media posts from a doctor here at the hospital, a doctor in a leadership position, and I'd like to make sure that this doctor is aware of certain things. On February 16th, the Lancet finally acknowledged that natural immunity is superior to mRNA vaccine. to mRNA COVID vaccines. Immunity acquired from a past COVID-19 infection provides strong, lasting protection against severe outcomes from the illness at a level as high, if not higher, than that provided by the vaccines. On February 15th, Florida Surgeon General Joseph Ladapo, MD, PhD, issued a health alert warning that the COVID-19 mRNA vaccines caused a substantial increase in reports of adverse events in Florida. Florida saw an increase of 1,700% in adverse event reports after COVID-19 vaccinations. Last week, Senator Ron Johnson offered VAERS data on COVID-19 vaccine injuries. Of the 34,385 worldwide deaths, 8,680 occurred on day 0, 1, or 2 following vaccination. He then asked why government officials were concerned. I would hope these numbers concern everyone in this room, and if not, it's time to take a hard look in the mirror. It's been made clear that many in power have censored narratives in opposition to their agenda, and we've had enough. Concerned citizens will continue to demand truth and accountability.
Thank you. Dr. Weinstein, Dr. DePonte, followed by Christine James.
Hi, I'm Dr. Sherry Weinstein, and I'm here again. Thank you very much for allowing me to speak. I'm here to represent my patients, my friends, and my family that are vaccine injured. Many of them died within days or weeks of receiving the vaccines, and many others were fighting severe vaccine injuries. I'm also here to represent the doctors that are too afraid to come forward to speak. We want to use the most effective medications and not have parties standing between the doctor-patient relationship. I was only able to save over 600 COVID patients by using medications like ivermectin and hydroxychloroquine after doing significant research and seeing them being used around the world. There was plenty of data supporting it, and I provided board members with the FLCCC, American Association of Physicians and Surgeons, booklets that handles all of that outpatient and inpatient care. I hope you will look at it. We have not had comparing performance data to other hospitals that were similarly incentivized is not a good metric. In 2021, the HHS and Department of CDC spent $13 billion in the COVID-19 community core and paid hundreds of organizations, including American Medical Association, American Association of Human Practice, to push narratives against ivermectin and hydroxychloroquine. Let's compare our outcome data with hospitals that did use the other regimens and were far less vaccinated. We haven't had any grand rounds with COVID treatments. The people who tell the truth can deal with dissent. In fact, truth tellers welcome debate. World famous doctors are waiting to come here and get grand rounds. I want to know, why have we not invited them? This is a sad time with trust in the medical profession and an alternative. More people are reading peer-reviewed publications advocating that drugs that we restricted SMH. The studies show the dangers and lack of efficacy that with the ones that were used and with vaccines. Recall that the directors of CDC and FDA both went against their advisory boards when they passed the COVID vaccines. These vaccines are a major cause for an increase in death, disability, and hospitalizations, but it's hard to track it because there's no ICD-10 code for a COVID-19 vaccine injury. We can't even adequately consent our patients because the vaccine package inserts for all of them are blank, like this. I want to show you how many doctors, a lot of them left already, how many doctors have filled out a VAERS report? I filled out hundreds of them, and you're not paying attention to doctors, to patients that are coming in after a vaccine injury, and rightly, we need to report it. The expiration dates on the vaccines that I have in my office were changed this year. 2069.
Would you like to submit written comments for the live to receive those? Thank you. Thanks, Dr. Dufonte, and I would ask that you move your hand while you speak. Christine Jennings, and followed by Sunny Kutcher. So Dr. Dufonte.
Thank you. Thank you, Chairman Tran, for providing me with an electronic copy of my complete medical records for my hospitalization here in August. I have provided an affidavit for the basically the last 20 hours of my stay here. Because I only have 3 minutes to speak, I put the documentation into the affidavit, and it provides basically a record of the fabrications in my medical records for those last 20 hours. The records show that I was lying in bed in my room with high flow oxygen through nasal cannon. I was obviously very, very weak, but had asked to leave the hospital AMA, against medical authority. Because the nurse had told me I would be allowed to do so, so I was lying in bed waiting to sign my AMA papers. Here's one small part on page 712 of my record, written by Dr. David Shear. He wrote, quote, reportedly, end quote. I'm going to stop here and ask the doctors in the room, how many of you do your chief complaint and your patient history based on rumor? Please stand up. I want you to notice, board, that nobody, no doctor, bases their chief complaint and their patient history based on rumor. Unfortunately, the doctor that wrote here did. So yesterday, I received a call from Dr. Simmons, who asked if I had any questions about my treatment at SMH. Very nice gentleman. I asked Dr. Simmons, why was I not allowed to leave the hospital AMA as I asked to? 1 minute. Dr. Simmons answered was you were Baker Act. I asked Dr. Simmons, why was I Baker Act? He said, because you get a security guard. The issue with that is the security wouldn't be called in until after the patient is Baker active. And the nurse had told me I was leaving AMA, so I was lying in my bed. In essence, my medical record claims that I punched the security guard before the security guard entered my room. Dr. Simons couldn't explain how I could hit someone who wasn't in my room until after I supposedly hit her. I suppose Dr. Simons, after reviewing my chart, is sitting with me at the hospital that he wronged him. Chairman Trent, you have given the Quality Review Committee a chance to review the cases and provide transparency. They have failed. It's time for a special committee to review these cases and review what pressures are being put on the doctors, like Simmons, to conclude that everything is normal, which couldn't possibly be.
Thank you. This one's record, Dr. Dufonte is Dr. Sinno. Dr. Sinno. Okay, next is Christine Jennings, followed by Sunny Kutcher, followed by Lori Moran.
I'm going to speak for myself and for Dr. Sarah Pappas, who cannot be here. And for me, I would like to say I want to thank every single person that works at the Sarasota Memorial Hospital. We are very fortunate to have you. We appreciate you. We support you. And thank you for everything that you are doing and have done for us in this community. Dr. Pappas asked me to read this on her behalf. I have been a partner, a patient, and a proud volunteer for SMH for close to 25 years. As a partner, I witnessed, as president of the State College of Florida, I witnessed SMH support the RN nursing program at my college by donating hundreds of thousands of dollars in support of scholarships. As a patient, I was treated with the utmost care as I went through several surgeries. And as a volunteer, I was trained to represent the highest standards of the hospital. I have always been proud of our award-winning hospital, the administrators, the physicians, the nurses, the support staff, as they have all consistently cared about the safety and health of patients. They have invested in cutting-edge equipment and medicines to ensure the health of our community. They have met and exceeded all the high standards of an excellent hospital. I support the decision relating to masking vaccinations made by the administration during the COVID-19 epidemic. I also urge the hospital board to preserve and not destroy the integrity of this great institution. Let the profession and expertise of the highly qualified doctors at SMH guide us into the continuing process to protect our community. Thank you.
Thank you, Dr. Thank you, Dr. Pappas. Next is Sunny Kutcher, followed by Lori Grant, followed by Bill Newman.
Thank you. My name is Sunny Kutcher. What a predicament we all find ourselves in, that the ones who are supposed to uphold an oath to protect and care for the most vulnerable are the ones who have stoked the fear of humanity so vigorously that innocent people have suffered as a result. You are here to serve the community's needs. We are all here because we are now confronting the sad reality that the medical institutions in this nation have turned against the people. They have planned hidden agendas, carried out these plans to injure people and experiment on the citizenry, and are now in the cover-up process. You may feel satisfied with a COVID pandemic quality check that you all conducted based on the policies that you have implemented, and now will approve with a pat on your back so that you may move on with your lives, absolved of your responsibilities, and have dodged the public who are angry with no answers for the loss of their loved ones. We are in fact a nuisance to the very institutions that are meant to save lives. You mentioned your willingness to engage in an analysis of how an experimental injection that you administered affected Americans who lost their livelihoods, or worse, their lives, but will you engage in that analysis? I myself was mocked, ridiculed, and fired for not complying with the unconstitutional Marxist vaccine mandate. I know dozens of people who have taken this experimental injection and are subsequently experiencing life-changing consequences, such as cancer returning, MS diagnoses, fainting, blood clots, seizures, and even death. I know a healthy man in his 40s who came to this very hospital with the COVID virus and was refused the early treatment he specifically asked for. His health declined, was subsequently isolated, put on a ventilator, induced into a coma, and then passed away. When the hospital called his family about him, they had incorrect information and spoke of the wrong patient several times. That's what you all have clapped for. Young and healthy children are dying on the soccer field after being injected with a substance they don't know anything about for a virus with a 99.9% survival rate. There is something wrong when people who are waiting for organ transplants are being denied because they are not vaccinated. Public trust has deteriorated so severely that many feel those working in medical institutions care more about their positions and power than the health and best interests of the most vulnerable. Do you think this many people would be here in protest of your actions if you were doing something that they supported? Many people who got this shot did not realize that their freedom had been stripped away, but we do. And despite their unknowing, the ones who resisted fight for their freedom. This nation stands alone on being founded upon our God-given freedoms, and we will never stop fighting for the truth. Today is the day to confront your conscience. I conclude with a verse from 2 Chronicles 7, verse 14. If my people who are called by my name will humble themselves and pray and seek my face and turn from their wicked ways, then I will hear from heaven and I will forgive their sin and will heal their land. Thank you.
Ms. Brand in the audience. Going once. Good. Here she comes. Followed by Bill Noonan, followed by Lisa Roulette.
I'm gonna speak as a little bit quickly. I just want to say that my father-in-law, my husband has 6 children. He passed away from COVID, and we were unable to see him, not at this facility. And I feel so terrible for all those families who lost loved ones. But we cannot allow COVID and the political issues that accompany it distract us from this beneficial contribution that our healthcare system makes to this community, especially in view of the challenges that we all face today. After the extreme overload of the COVID pandemic, The hospital system and our county in general continues to be severely strained. Our facilities are overcrowded, understaffed, and the physicians and services, along with our strategic plan, need our support. Last week, my neighbor was unable to obtain a hospital bed and was only able to do so when she required emergency brain surgery. She eventually received excellent care. Following the 1918 flu pandemic, many similar issues were politicized and had consequences that we cannot afford to repeat now in 2023. Our forward momentum cannot be derailed by a constantly mutating virus that became a pandemic and is now endemic, similar to 100 years ago. Sarasota Memorial has remained committed to its nationally recognized excellent reputation with an A rating in patient safety. As a voter, I ask that this board move us forward. There is much work to be done. My family moved to Sarasota in 1959, well over 60 years ago. Dozens of my family members have availed themselves of the services of this hospital. We've been through the emergency room and had surgeries, and many women, including myself, have had our children here.
1 minute.
Without question, the majority of our physicians are absolutely committed to obtaining the best quality of care for us, their patients. I am certain that many people in this room and at the board table depend on this quality of care for their neighbors and their loved ones. This year, my friend's granddaughter was in the neonatal intensive care unit for a week. With our extensive services available to all our citizens, we cannot afford to become distracted from the job at hand, which is protecting and growing this community gem to serve the citizens of our county. Thank you.
Thank you. I was thinking that Marty Grant served on this board for over 10 years, and as I passed chair of this board. As is Bill Newman, who's speaking now. Next, followed by Lisa Rolette and John Littell.
Yes,
Mr. Newman, you have
my name is Bill Newman. As you mentioned, Sharon, I am a former member of this hospital board. But more importantly for this discussion, I and my wife have been frequent patients in this hospital. And for any lawyers in the room, I have their permission to say that. Before we moved here to Sarasota 10 years ago, we lived in Boston for many, many years. There are a couple of hospitals in Boston you might have heard of. Mass General, Brigham and Women's, etc. Guess what? We were also frequent patients in those hospitals. That brings me back to Sarasota. And I'll agree with Greg Stubbe when he said that Sarasota Memorial is a gem. I feel it's a gem. I know about hospital care, having experienced it personally, and I'm very happy with care that we received at Sarasota Memorial, and I put that within the hospital around the country.
Thank you. Mr. Newman. That was Lisa Rolette, followed by Dr. John Littell, followed by Mr. Bruce Flegler. Yeah, I apologize for my inability to read our letters. Lisa, welcome back.
Thank you. I reviewed every single comment from the November public comments. I've also been hearing from patients here talk about the concerns they have about COVID care. The concerns of the loved ones about the COVID care here is what launched the investigation. Many of the concerns result because ivermectin was denied. I was hoping we get answers from your internal review about the research findings that led doctors here to deny this FDA-approved drug with an excellent safety profile that studies reflect is highly effective in treating COVID. But you didn't answer those questions. I hoped you'd answer the public's questions about remdesivir's use. This is an antiviral drug. Is it being used here during the post-viral period? But you didn't answer that either. I was hoping you would invite Dr. Pierre Gorey of the FLCCC Alliance to learn about the protocol that
many of your community members have been begging for, and that they say you've been denied. But you haven't invited. We still have the exact same questions we came here with before your investigation. We are still at square one. Your review answered questions we didn't ask. We didn't ask, how is your protocol compared to other hospitals that use the same protocol? Our question asked, why are you not considering protocols that experts are saying are resulting in many more lives being saved?
1 minute.
We would love for you to research this and tell us why. In fact, your internal review tells me that we need more than ever an independent investigation because it adds a new question. The new question is, why aren't you looking into our questions? Why are you avoiding them? Why are you silent? In closing, I'd like to say, you, the board here today, are our safety net. We have life and death burning questions. You tell us this is the way we do things here, but you don't tell us why. We would like an independent investigation. We would like a question and answer session. Please let us ask you our questions. Please give us those answers in return. If you fail to stand up for the safety of our families by calling for an independent investigation, we, the citizens, will not hesitate to take up our role as the final safety net, because our community is counting on us, and we will not let them down.
Chairman's prerogative here. Assuming that the board will vote to release, I want to address your point. Assuming that the board will vote to release the report, I think you'll find an extensive appendix where we took the videos from November, from December, and from January, and took all those questions. And I know that many of the board members insisted that we answer those questions that were on the videotape. So we will hopefully release it later after this meeting, and I encourage you to believe that. Love to hear back from you.
Thank you. Will it address who's it like our meant to?
I'm sure it will. Lisa's a frequent flyer. Okay, I'm sorry, I got distracted with Lisa. Dr. John Liddell, Mr. Bruce Flagler, I'm so sorry, and another from Melissa Conley. Dr. Yuck.
Yes, thank you very much. I had to shake your chief of staff's hand because having served as chief of staff at a major hospital in the Orlando area, I know getting those HCAP scores, willingness to recommend, is very difficult. You happen to be one of the best hospitals in Florida, and I'm going to say that. Sure, and I'm not pulling any legs here, so don't count that against my time because I'm giving you some good news. All right? That doesn't mean I've been a physician for 33 years, board certified family medicine. I'm an Army veteran. I served in Desert Shield as a SNOR Joint Task Force Guantanamo Bay. My very first patients at George Washington University in 1985 were men with Kaposi sarcoma and pneumocystis pneumonia. We didn't know what was going on. Those patients got a lot more personal attention and a lot more compassion than we ever saw with the COVID patients in any hospital in this country, regardless of their HCAHPS scores. I still have privileges at 5 different hospitals. I'm on call, as I said, 24/7, and during this Operation COVID-19, I have to say, I'm going to be 65 this year, I never worked harder as an Army soldier. And all these guys behind me, and all these nurses know, we never worked harder as men and women in the medical profession than we did during the Delta variant. So I'm not here to condemn at all anybody, but I'm here to see a little bit of insight and try to calm things down because, you know, I had a lot of training before I told you. My first patient was at 8 o'clock this morning in Ocala, Florida. My next patient will be at 8 o'clock tomorrow morning in Ocala, Florida. And I worked until 10 o'clock last night. And I'll work until 10 o'clock tonight. That's what I do because I love my patients. There's no hope without, there's no healing without hope. There's no healing without relationship. And both of those things are in the gutter during the Delta variant. So let me give you a few quick stories, because I only have a couple of minutes.
One minute.
Okay, let me tell you about the mayor of the car salesman, New Year's Eve, 2020. Car salesman comes into one hospital, he's refused ivermectin, he spends 3 months in the hospital, he survives. He says to me after he got out of my car for my daughter, I survived because of you coming to see me every day when I couldn't see my kids, he's the only parent who since 12 and 15. The mayor calls me, he's hypoxic, chief of police, fire, he's got the Delta variant. He gets into another hospital, guess what he gets? He gets ivermectin. All right, the only patient in the entirety of the Delta variant got ivermectin legally. Let me tell you about the wife, the persistent wife, who I gave her ivermectin. She insists on staying with her husband. He was in the hospital for another 3 months. He walked out of that hospital because she gave him ivermectin. Let me tell you about the new mom. When the obstetrician called me, I actually talked to the other obstetrician, said, "Do you know anyone that can treat a woman with COVID?" I go to this woman's bedside. After giving birth to her baby, she works a nurse across the street at the other hospital. I'm not going to mention any names. She went to the ER with COVID. They said, "We come back when you're under 90% oxygen saturation." She was admitted for her baby, C-section. I walk in there, she's blue as can be, no O2 sats, excuse me, sir, 72% pulse ox, and nothing being done. I took ivermectin out of my pocket, I gave it to her. Now I got dozens of cases I can't share with you, but let me just tell you this. One more minute, sir. No, I took 2.5 hours. Just let me say this. We are not noise. I'm going to tell you this. If you're going to be the best, be the first to admit wrongdoing in all humility, and just realize that these lives would have been, just think of all the patients' lives that would have been spared. And I was disciplined for giving ivermectin. I've been fined $500, I've been suspended 2 weeks, I've been on the American Board of Pain Medicine, the Florida Department of Health, and trust. Thank you. You take care of patients.
Fleetler, Melissa, you're next. Matt and Michelle, Rosie, you're out.
Thank you, and I appreciate the good job with my name. Thank you for the opportunity to speak. My name is Bruce Fleetler, and I've been a member of the Sarasota Memorial Medical Staff for many years. I've been privileged to serve in several medical staff and hospital leadership positions, including Chief of Staff and Chief Medical Officer. As a hospital, the board knows, for numerous years we've been fortunate to receive the coveted 5-star rating. These are not 5 lucky stars, they're 5 shining stars. They're the results of the dedication and hard work of medical and hospital staff, utilizing logical thinking, quality information, and endless hours of commitment to implement the best medical care and compassion. At the board's December meeting and again today, we've heard and we're very deeply moved by the personal devastation of the earlier stages of the COVID pandemic for both patients and their families. We also heard about and continue to see the extreme dedication of our medical and hospital staff. As was the case throughout the country, our staff worked dramatically increased hours and put the lives and the lives of their families at risk. The medical staff met weekly and sometimes daily to make certain patients got therapies that were proven effective. At the same December meeting, the board and the community also heard about the multiple public and private regulatory agencies with whom the physicians and hospital must satisfactorily comply to ensure quality. And we do that 365 days a year. Within the hospital itself, there are also numerous medical staff groups who meet regularly to maintain the high standards. It's also the responsibility of the physicians and the hospital to promote sound medical information that prevents the spread of infectious disease from overwhelming our hospitals and patient care. Hopefully, the information presented earlier in the meeting and the facts will foster good decision-making at our institution. All of us have the responsibility to leave politics at the door. Our lives depend on sound judgment and decision-making, and importantly, on the focus to move forward.
Thank you, Dr. Melissa Conley, followed by Michelle Tosi, and followed by Lori Montel.
Board members, since we have the contractor analogy, I'm an RN and I agree to an MD. So, this internal investigation of the failed SMH COVID response was announced at the November 2022 board meeting after public outcry from multiple families alleging wrongful death. Almost 3 months later, we are hearing the results of this so-called investigation. But something is very wrong. Families are reporting that SMH officials did not reach out to them until 2 days ago on Sunday. How can any investigation be thorough when the families who have lost loved ones are contacted only 2 days before the investigation is completed? We, the public, reject your internal investigation. Where is the acknowledgement of wrongdoing when you call the family 2 days before this date? You are the fox guarding the hen house. It appears this hospital is running scared of the public. Board members aren't answering the public's emails. Board Chair Jim Hudson has reduced public speaking time to 3 minutes. Don't you think the board should give the public whose loved ones died at your hospital their due time to speak? Maybe it goes even deeper. Maybe this taxpayer-funded hospital actually has disdain for the public. After all, you shut families out from seeing their loved ones in the hospital during COVID. Many people died without ever getting to see or speak to their families. You even put a doctor in restraints when trying to advocate for another patient's COVID treatment. It's time for an investigation to be performed, an outside investigation to be performed by people outside of your institution. The public would like to know, number one, why did SMH doctors who took an oath the first to harm reportedly blindly follow them with COVID protocols? Is it because the federal government incentivized hospitals financially? Is it because SMH has so many employed physicians who are not free to practice with autonomy and must answer to administrators to grant their paychecks? Were the patients given true informed consent before being put on these protocols? Did reduced staffing play a role in these alleged wrongful deaths? Was this reduced staffing due to the COVID vaccine mandates? SMH, in summary, we the public reject this COVID cover-up. We the taxpayers gave almost $70 million in taxes to your hospital last year. If the public can't get email responses from board members or transparency from the SMH regime, it's time for an outside investigation. Any major corporation with a failure like this would fire its CEO, especially given his $12 million contract. For millions of tax money has allowed SMH to monopolize medicine in Sarasota by buying out independent practices and employing doctors. Employed doctors answer to administration, not patients, and this relationship is the enemy of true medical freedom. SMH and its employed physicians are incentivized to be an extension of the federal government. It's time for SMH to be stripped of its taxing power, and it's time for employed physicians to speak up. Otherwise, they are complicit in medicine, and this hospital will never be the same. Thank you.
Thank you. Lori Montel, followed by Barbara M. Vaughn. Welcome, Michelle.
Thank you. Michelle Posey, I want to start here by saying I think it's wrong that you took the time to speak from 5 minutes down to 3 when this is our only chance to address you. I know we're Facebook friends, but not everybody here is. So I think that was really wrong. I noticed that you took the liberty of getting a third party to provide you with data. Where's the third party investigation? You're halfway there. Give us the whole way. I'd like to say that in November of 2021, you, the brightest minds in medicine, imposed a vaccine mandate for all Sarasota Memorial Hospital employees, despite our governor's protections that allowed for medical freedom. 5 days ago, the Lancet Medical Journal, one of the most prestigious medical journals, published, quote, immunity acquired from a COVID infection is as protective, if not more protective, than vaccination. However this happened, you got it wrong. Good, hardworking healthcare professionals were forced to fall in line or get in the unemployment line. The bottom line, you were wrong. This isn't about anti-vaxxers, as your alleged chief of staff said. We need to pull our head out of our, what's that? Maybe he can say that again. This is the fact that we're human and completely capable of making mistakes. This is about an ever-changing field of medicine that cannot merely be dictated by unelected bureaucrats. We're supposed to be in this together. Let me ask you, when someone dies on the operating table, does the surgeon perform the autopsy, or does an outside entity with who specialize in that field determine a cause of death after a complete analysis. What angers me today is that you get it. You understand perfectly well why there needs to be an external third-party dissection of what took place within this taxpayer-funded hospital during COVID. You have countless accusations of wrongful death, mistreatment, and neglect, along with a complaint of being chained to a bed. And you want to put together a committee to handle this.
1 minute.
Committees are for choosing what paint color to paint the maternity floor, not for holding institutions accountable for the accusations made in this room. This institution needs the community's support. We're building a big one in Northport. If you think our Northport residents are going to come describe, you got another thing coming. This institution needs the community's support to continue to grow and thrive. The community needs a healthcare system that operates on complete transparency and accountability. Without that, guys, we both suffer. Get this right. Get an independent external investigation into the handling of COVID. Thank you.
We have many more speakers, so I'd ask again that the audience please respect speakers by holding your comments. We will now be heard from, we will hear from Laura Martell, followed by Barbara Vaughn, followed by Maureen Gertrude. I might miss that. So,
thank you for this opportunity to speak. I'm going to start with prayer. Heavenly Father, in the name of your Son Jesus, cast out all evil and send us your Holy Spirit, Lord, to convict the healthcare workers to stop using the CDC protocol, repent, and join us in the spiritual battle to save lives. Amen. I say this prayer every time I drive past the hospital because my sweet sister was killed by healthcare workers using the CDC COVID protocol. My sister did not have COVID, nor was she even tested for COVID. Yet the hospital labeled her as a COVID patient. At that point, my sister lost all her patient rights. She was given no informed consent. The doctors refused to give her the treatments that she wanted and needed because they insisted that they could only use the CDC COVID protocol, which led to her organ failure, decreased respiration, ventilation, and death. Just because you check off a little box that you followed the minimum standard of care doesn't mean that you gave the best care to your patients that would have saved their lives. We are the richest country in the world, yet we have the most COVID deaths, over 1,100,000 COVID deaths. Florida's the third highest in our nation, at 86,294 deaths. We lost 21,128 patients last year, 305 patients last week. People think COVID's over. It's not over for the patient that's going to a Florida hospital. And why? Why is this? We heard through the CARES Act, hospitals are paid monetary incentives to use the CDC protocol, which kills their patients, and then they believe they have immunity. But Florida law states there's no immunity when there's gross negligence, intentional misconduct, or fraud. Hospitals using the CDC COVID protocol are grossly negligent as they are consciously disregarding their patients' rights and lives because they're failing to properly treat a condition where there are many known treatments that have been proven safe and effective, like the FLCCC MAC+ protocols. Instead, they're using drugs like remdesivir proven to cause kidney damage and death. So today, thanks to the American Project, FRA, Moms for America, grassroots have launched a statewide campaign calling on Governor DeSantis, Dr. Ladapo, Ashley Moody, and sheriffs to terminate the immunity law and do statewide criminal investigations to hospital COVID deaths to hold those responsible accountable. Genesis 9:5 says, God will demand an accounting for human life. How will you explain to Almighty God that you and your staff simply followed orders to use a protocol that killed your patients and you did nothing to stop it? This is your opportunity right now to repent, and instead of following your hospital's orders to use a deadly protocol, follow God's commands and save lives. Thank you, and God's good.
May I ask a question, Mr. Chairman? I'm sorry for the loss of your sister. I know you're from Venice. Was that in our hospital or another hospital? I'm just would like to know.
It's not in your hospital, but like has proven, it's every hospital. And I speak across the country and I represent families. I actually am a patient advocate and I hook them up with doctors who will save their lives. So it's in every county, every state in our nation.
I'm sorry for your loss.
Thank you.
Thank you for being here. Next, we'll hear from Barbara Vaughn, followed by Maureen Gertrude, and I may have that wrong, followed by Mary Price. Ms. Vaughn.
As I recently shared with your chair, Trey Hudson, I've given my family and friends instructions, strict instructions, that if anything happens to me, I am not to be brought to Sarasota Memorial Hospital. I have a hunch knowing what I was going to say might be the reason why I'm near the bottom of your list of speakers, in spite of the fact that I filled out my speaker's card among the first 12 or 15. Anyway, the reason for this is I don't trust you. I know that's not what you've been hearing from staff members who've been recruited to be here and those that they have recruited to testify to their dedication. Nobody needs to testify to their dedication. I haven't heard anybody here criticizing the nurses and doctors on duty. I'm just one person. So if I don't come here, it doesn't make a big difference. But I'm one, and our numbers are growing, and they're growing dramatically. I don't want the government directing my health care. That's why I won't come to Sarasota Memorial Hospital. A great many other people have come to the same decision. In my opinion, this hospital and those medical professionals remaining here have sold out to CDC and the NIH protocols. In other words, the government. Your Quality Care Committee looked at the logistics and the procedures of following the CDC and NIH directions. Not the high dollars coming from the government by following those protocols. I'm sure those dollars had nothing to do with it. Sadly, I have learned since coming here today that doctors are no longer required to swear to the Hippocratic Oath. Does that mean you no longer swear to do no harm? I wonder. My heart is with the medical professionals who quit their jobs here and at other facilities rather than take the government mandated so-called vaccine, which we now know was never worthy of mandates and never worthy of being given to people without more testing.
Thank you, Ms. Vaughn.
Here are strict protocols mandated.
Thank you, Ms. Vaughn.
This hospital,
Thank you, Ms. Vaughn.
have you heard of the Great Reset? You need to step up on the Great Reset.
Thank you, Ms.
That's
Vaughn.
what you're on heart.
Okay, next is Maureen Gertrude, I may have that wrong name, I'm sorry if it is. Mary Price, followed by, I think Wendy Williams has already spoken once before, thank you. I believe so. Followed by Christine Schlesinger.
My name is Maureen Blaze Kester. Slow down. I'm a physician assistant, been in Sarasota County for 22 years practicing. I have privileges at this hospital, and I've been in this hospital as a patient. When I send patients from my office to the hospital, I always say, take them to SMH. Because SMH is an awesome hospital. You know, you can look at the figures, there's been some illusions here that somehow Sarasota Memorial is making all this money off COVID. The data doesn't support that. They just said we lost $60+ million. in this COVID epidemic, so that doesn't square. And the people that said that this was 99% survivable, should ask some of the people whose families have lost members. We had refrigerated trucks here at Sarasota Memorial because the morgue was full. So yeah, Florida is among the top 3 in the nation. Yes, we also have a very low vaccination rate here. I did take a credit vote to do no harm, and I am not going to prescribe a protocol that has not been proven. If you show me the data, if the data gets approved that ivermectin is a wonderful drug and should be given, I would be happy to do that. But that data is not there. And the hydroxychloroquine, that actually was approved by the FDA in the beginning of the pandemic. It was used here at this hospital, as far as I know. It was also withdrawn by the FDA because it was found to be ineffective and had some serious heart effects. Also, some of the people who needed it, and their rheumatoid arthritis patients couldn't get it because it was being used for COVID when it should not have been. There's a lot of statistics out there, there's a lot of misinformation out there, and a lot of this has been politicized. It really makes me sad that so many of these people don't trust science. Show me the science, and I will be happy to look at that. But I'm not going to prescribe something that I think is going to be harmful to a patient. If I have a patient that comes in and says, I want a heart medicine for my Parkinson's disease because I think it's a good idea, I'm going to say, no, I don't think that's a good idea. So, I just hope that we can all come together and just get through this. This has been a really bad 3 years. And I would like to see us come together on this.
Thank you,
That's all I have. Thanks.
Thank you very much. Next is Mary Price, followed by Christine Messenger, and followed by Michaela Matthews. May I have that first?
Yes, hi. My family's been here since around 1956, and I had several family members coming to Sarasota Memorial. I have never experienced that. But what I wanted to do is say that I appreciate everything the staff and the administration has done to get us through these 3 years of COVID, which has not ended. I just read yesterday's paper with more COVID deaths here in Florida. And I'd say that the staff and even the administration probably were working tirelessly 6 or 7 days a week, 12 plus hours a day. And to second guess everyone who were giving up their own lives, they go home exhausted and have to probably take off their clothes at the front door, try to protect their children and their loved ones, and not be able to visit their own families because they were in a high exposed position. I think the comments I've heard here today are just so disheartening that people don't appreciate the sacrifices that this hospital has given and people who worked here and everyone in the medical community over the last 3 years. And I want those doctors and staff people who are hearing these negative comments today to know that not everyone feels that way. That I feel that you've done everything you could exemplary. I'm glad you were there, not allowing people to come visit day after day, coming back out to the public and exposing me, because then I had to isolate even longer. And the staff, couldn't visit their own parents, they couldn't visit their own grandparents, as I mentioned before. And I recommend to this board that you take into account that this was a war on COVID. And this, happened back in 1918. And these things happen, and people want to do Monday quarterbacking on, COVID now. And not everyone's going to be happy. When my father was in the hospital, there were 3 people with pneumonia. The 2 70-year-olds survived, and the 39-year-old did not survive. So you can have the same treatment or different treatments, and not everyone's going to respond
the same. And if people don't understand that, then they don't understand that we've been in a war here with COVID. Thank you.
Thank you, Ms. Price. Next, it's names last year, followed by Michaela Matthews, followed by Kurt Volker.
Hello, and thank you for the opportunity to speak to you briefly. I'm a resident of Sarasota for over 12 years. I have been a nurse for 43 years, and the last 20 years as a nurse practitioner. First time I walked into this hospital was when I brought my partner in for a cardiac event. I immediately felt that this was a very special place. It was patient-centered. I've worked in several hospitals in my career, and I never had that feeling that this was truly patient-centered. As far as the situation here during the COVID epidemic, which we all agree is still not over, I think we were all trying to understand what this was all about. You probably all remember wiping off boxes that were delivered to your door, using rubber gloves to get your mail from the mailbox. It was an evolving base of information. Hospital care, patient care is evidence-based. And the evidence in COVID was ever evolving. It is still evolving. And I want to say that I want all of us, while we should be introspective and investigate what was done, I think we really have a fabulous hospital here.
1 minute.
We are a 4-time magnet hospital. Do you know how few hospitals in this country have that superlative designation of patient care and really great patient outcomes? I just want to commend the staff, the administration, and everybody who contributes to the excellent care that we receive at Sarasota Memorial. Thank you for the opportunity to speak.
Thank you. Next, Michaela Matthews, and followed by Kurt Volker, and I'll make an announcement. I don't have any other speakers, but if anybody wants to speak, I'll give you plenty of opportunity to speak. So,
It's Michaela Matthew.
Michaela, thank you. The floor is yours.
So greetings. Been here a couple of times now. As I said in November, I rejected what the panel had decided then, which was to do the internal review. And as you heard from many others, I still reject that. We need an external party, third party, to review this data, and it is to restore trust. We've seen so much corruption in our country and our institutions. The only way to restore trust is to not let the individual board that was involved in the decision-making that took place during COVID to be involved. It needs to include outside parties. There's no doubt in my mind that there are good people in this hospital. This isn't a war on the staff. This isn't a war on what they've done or what they've said or how they've treated a patient. This is an ideology that is pervasive in our culture. To have a one-size-fits-all protocol that's been adopted across this country is not practicing medicine. That's what people are fighting. I'm not here to fight truly for ivermectin or hydroxychloroquine. If you pull up C19early.com, you will see dozens of studies on lots of things that were tested for COVID, down to all the studies, all the data, how much they cost, how they performed. I have shared that with everybody. It said, learn the data, observe what's happening in these trials. It's an excellent resource, and it's not just hydroxychloroquine
for putting ivermectin, but to the product doctor, there have been 5 studies on ivermectin that are actually quite good. As I've been down this road, something I didn't realize is that there are multiple oaths. There's not just the Hippocratic oath. I don't know how many know this, but there's something called the Declaration of Geneva. It was adopted by the General Assembly of the World Medical Association at Geneva in 1948, and it's been amended several times. I think it's appropriate, given what we're seeing in our nation today, for me to read this declaration and for those medical professionals to maybe take this oath again and restore their faith in why they became a doctor. As a member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. The health and well-being of my patient will be my first consideration. I will respect the autonomy and the dignity of my patient. I will maintain the utmost respect for human life. I will not permit consideration of age, disease, or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me even after the patient has died. I will practice my profession with conscience and dignity and in accordance with good and medical practice. I will foster the honor and noble traditions of medical profession. I will give to my teachers, colleagues, and students the respect and gratitude that is due. I will share my medical knowledge for the benefit of the patient and the advancement of healthcare. I will attend to my own health, well-being, and abilities in order to provide care to the highest standard. I will not use my medical knowledge to violate human rights and civil liberties even under threat. I will make these promises following the NIH and the CDC and this board are not in their position.
Thank you. Kurt Holder. And make an announcement, I don't have any other cards. Kurt Bolger.
We expect some claps for that.
Say it.
I expect some claps for that. I'm Dr. Kurt Volker. I am a pulmonary critical care physician at SMH, and I am the medical director of medical research. I wanted to address some of the concerns about, first of all, clinical research, and that it's unusual for a community medical center to have such a robust clinical research center. As our main counter will tell you, we are far from a profit center. Our job is to bring medications and technology here years in advance when it's available to the lay population of the places. We did that during COVID. All right, it was our clinical research staff worked tirelessly to get us the tools we needed to fight this disease. And we were some of the first in the Southeast, some of the first in Florida to get some of these medications. That is the job of the Clinical Research Center. At that time, nobody knew anything about reimbursement. We as sub-investigators had no idea. Many of the trials that we did had no funding at all. It didn't matter. We wanted to get medications here, to do everything we could, to put every tool in the pockets of our physicians. I'd also like to give you a perspective from the airport. Basically, we were in the trenches. During the pandemic, there were no good answers. We listened to whatever made the most sense at that time. And I was an advocate of the FLC's protocol. I gave it to my patients here. I gave them hydroxychloroquine. I gave them ivermectin. I gave them hydroxychloroquine until the FDA indicated that it was.
One minute.
Okay. Anyways, so I was an advocate of those medications. Frankly, we still don't have the answers. Right now, most of the data, even after it shakes out from the randomized control studies, show that ivermectin was not necessarily the way to go. That there was no significant benefit from that. Now you can say that there may be, and most of the objections I hear is actually with the CDC, with their recommendations. It's not with SMH, because SMH had to follow less recommendations, which are coming down from the CDC. Me as an individual physician in my practice, if my patient and I decide they want items from something just in my office, I can do it. That is not the job of SMH to work on, to go against the CDC. And I just want to say that that's what we need here as a community hospital.
Thank you, Doctor. Appreciate your time. Okay. I lost track of how many people spoke, but I think it was probably 55, and I want to express the board's thanks for the citizens who came forward to share their thoughts and concerns. I think now I'm closing the public comment and opening the board meeting for board comments or thoughts from what you've heard, what we heard this morning. Or perhaps we can entertain a motion and then a discussion. As
One of the comments I wanted to add is that I know people keep on talking about how politicized it is, and I hate politics. There's nothing further that I would rather ever not talk about. But one of the letters that was written to a family member from Dr. Fiorica stated and called some of us board members COVID skeptics. So we're trying to bridge this gap and bring closure and healing and everything else. And yet, you know, we have our chief medical officer. I mean, I thought our board was supposed to come together and to bring healing and hopefully move past this. But when we're writing to the public and we're public board members, and then pigeonholing us as some of us, and it didn't say all of us, I'm sure it's referring to the new ones that were elected, and stating that there's a power struggle. I think that that's where we get some of this. I think there's just some misperceptions about our intentions. In the most recent week, I've had discussions with several physicians who are active staff here at SMH. They have shared with me that members of administration are telling them that the purpose of this board review was to go after physicians. This is the reason that we had physicians telling us that they don't feel supported by the board. And Dr. Hoffberger intimated to me that we could lose medical staff over this investigation. So I'd like to clarify a few points. In my desire to look into these matters, I've never stated or implied any desire to seek retribution against any member of the medical staff. I believe that's a severe misrepresentation of our goal in order to divide this board and to alienate the medical staff against the board. I worked with a lot of you in one capacity or another. I think it's fair to say that my primary passion is for patient care, as is most of yours. Judging by your response to our inquiry, I get the sense that you feel professionally attacked in your judgment's question. I understand that. I think that you do have your best to care for patients with the information you've been given. However, I think anyone with any intellectual honesty will admit that there has been suppression of alternative viewpoints. I would ask why this suppression, in the history of medicine, has there been such a push down to punish anyone who professionally dare question the narrative? Part of determining truth in medicine is the need for it to stand up to rigorous testing and debate. This is part of the goal. Every single day there's more understanding of the severe sociological and medical cost associated with the COVID protocols, including social distancing, masking, and vaccination. In fact, you may recall when the CDC and NIH stated natural immunity was not protective against COVID and that everyone must be vaccinated. And we've heard today that the Lancet has published and stated that that is not the case. So, there were other studies earlier that alluded to this, it's just they were ignored.
So not all the physicians here, at least the ones that I have spoken to, are share your disdain for the lovers of medical freedom. However, most are afraid to speak out because they are worried about losing their livelihood. My job as a duly elected member of this hospital board is to represent the taxpayers of Sarasota County. I have to answer to them and not to this administration. So I hope that that clarifies a little bit of, I was upset when I saw that there was something inside of the doctor's lounge stating for, yet again, the auditorium to be packed. And it was upsetting because I thought we were here to heal and move forward and be transparent, and that was not the case.
Thank you, Bruce. Other board comments?
Yeah. I'm just going to reiterate what I said at the committee meeting, which is basically that I feel that this report, which I think is excellent, should be released as a draft. And I think in an appropriate amount of time, a month or two, we should allow the public to review it, give us input, and then review the input to see if there's anything that in the public's review that either we missed or should be added to the report. Thank you.
Thank you. Any other board members who would like to make a comment about what they've heard, or maybe perhaps we can?
Hi. I was going to say, as a board member, we've spent, what, close to 10 hours?
You've been in here 10 hours.
10 hours today. And we have the privilege and benefit of reading the report, which is a couple hundred pages. So I can say that when I went through the report, there were 4 things I looked at. And one was, what were the outcomes that we had? We used an independent third party who basically said we had 24% better outcomes than our peer group.
Just send a letter, no, we're just quite going.
Workers,
Well, you made a mistake in my mind. That's why I asked her. I said, thank you for your advocacy, for patience.
Continue.
All right. Second thing is to follow the money. I'm kind of a numbers guy. And did the hospital benefit, or was there any reason that they made decisions based on money rather than patient care? And there was none. The third, which I think is the most important thing, is the connection between the doctor and the patient. And any doctor that wanted to prescribe ivermectin or any medical treatment that they felt was best for their patient was not followed by the hospital. And I think that's important. And in fact, some of the speakers who were physicians actually recently even used those medical treatments. So there was no, conspiracy or blocking by the administration of what the protocol was for, a specific physician. And then lastly, there was a lot of discussion in the meeting about how employees were treated and when they were told to get a vaccine and how the waiver process worked. And it did work because a lot of employees did not get vaccinated and they didn't lose their job. No one lost their job. So that's what I was looking at. I felt the report, and you'll be able to read it if we approve it. We'll show you what I mean. You'll read what I read. And I thought the report was very well done. The staff is dedicated. The staff came to work not knowing if they were taking home a poison to their families. You needed paperwork to be on the highway at different times during this. I applaud the staff for the work they did. I applaud the staff for the report that they did that I thought was very transparent, very educational. You made a motion. Do you want to second it?
Are there any other board members who would like to address? Okay.
we all have the ability to have a freedom of conscience. And so whatever you would like to think about me, please have that thought. You may be surprised to learn that in the last 2.5 years, I have suffered a lot of loss too. We all are grieving in different ways over the last 3 years. I have 4 children. I have birthed 2 of them through the pandemic. My dad died. And he wasn't able to hold his child either. And I vividly remember him saying, I wish I could have hold her. It hurt my heart so much when I heard one of our constituents share that story about her husband not being able to hold his grandchild. I feel the loss. These people feel the loss. My husband deployed in service of our country in the Navy when my last child was 2 months old at the height of the Delta surge. That was intense, and yet I showed up at the board meeting the month after I gave birth because I care about this hospital and I care about the patients in it and the doctors and the families. Interestingly enough, no one came to our meetings, our committee meetings, or our public board meetings until June of 2022. The pandemic started in March of 2020. Just keep that in mind. We do care. I want to respond to a couple of points, but again, I will reiterate that I am proud of this report, and I believe it speaks for itself, and I encourage each of you to read it for yourselves. Should this board take the committee's recommendation, which earlier today was voted 8-1, but I will address a few of those points now. With regard to the vaccine, this hospital never mandated it. As far as board voices go, I was the first board member to say under no circumstance do I want any of our employees to experience that vaccine mandate, and the only other board member that I remember specifically voicing that was Sarah Lodge. That said, this board never indicated that that was the desire that they wanted for our staff. Secondly, with regard to questions such as, can we have a speaker come? Yes, that is on page 52 of the report, should it become available. Your questions are addressed. However, as Dr. Volker attested, there are some things that do lie outside of the purview of this hospital jurisdiction. There have been concerns raised about vaccine safety, studies and recommendations issued by federal agencies. That is not within our purview. You don't go to your congressman to ask for a new playground in your hometown. You have to go to your appropriately elected representative to take the issues to the right places. Please contact your federal representatives to take these worthy fights to the right locations. Also, I stated in detail our plans for moving forward, which did address issues around communications with families when they cannot be together, regardless of COVID protocols. If someone's away at work, if someone's in a different state, ways to learn to make sure that we can strengthen the ties between families and patients and physicians. Also, I want to make sure that you understand that we take seriously our new board members' thoughts about patient advocacy and staff advocacy. That is part of the Health Emergency Response Committee. There will be dedicated people on that committee representing staff and patient advocacy issues. That is a fruit that has been born of this 3-year struggle. Regarding finances, I covered it at a very high level, but there is great detail related to costs, not just received, but incurred from drug trials, from lost revenue. Please, once again, read the report. We are living in a Twitter soundbite generation, but read the report. That is what I have to say for now.
Any other board comments? I would entertain a motion from the committee.
So. I move to accept the Sarasota Memorial Healthcare System response to COVID-19 pandemic report and to adopt the recommendations contained within the report as recommended by the Quality Committee.
Second. The second, by Sarah Lodge. Any further discussion among the board? I'd like to ask the assistant to the board for a roll call, please. Continue with the roll call.
Mrs. DePeters?
Yes.
Mrs. Fiorucci?
No.
Mrs. Lodge?
Yes.
Mr. Rowe?
Oh, no.
No.
Mr. Baker?
Yes.
Mrs. Mariah?
Yes.
Mrs. Reiner?
Yes.
Mr. Carter? And Mr. Hudson?
Chair votes yes.
Thank you.
Motion passes at this time 7-2 with one reversal. From the board. That concludes our portion of this board. Is there any other discussion that we need to? Yes, Mr. Patrick. The report will be online within 30 minutes at the end of this meeting. It's very extensive. I encourage you to read it. Questions will be answered, I think, appropriately. And if you'd like to give us feedback, come back in March. Is there any other business to come before the board?
Mr. Chair, I'd like to reiterate, Brett Warren actually commented, please read the report. I couldn't agree with Brett more. It's a very well written report, and you're not going to understand the issues sitting here in this room. There's 800 expensive man hours went into producing it. Please read it. Thank you.
Mr. Baker, you had a comment?
I'm just going to say.
They didn't.
All right, that's not necessary. Thanks. By approving the report, you'll be able to see it. If we didn't approve the report, it would not have gone live.
That's true.
And the report is incredibly well done. A lot of information there. And the other thing I was going to mention is they have our email addresses. And if they want to send written comments, that's fine too. And that becomes part of the record. We encourage you to come and speak, but some people can't stay or have to leave or maybe don't like to speak. And we want everyone to be heard, and that's another vehicle for use.
Is there any further business coming before the board? Here none, last item is legal report. This meeting is adjourned.